Welcome to the special webinar on preventing pandemics through the One Health approach. Today's event is co-hosted by the ASEAN Interparliamentary Assembly and its MOU partner, Freeland. My name's Steve Gelster. I'm the founder of Freeland and also the co-chair of the EndPandemics Campaign Alliance. Freeland is also part of the USAID Wildlife Asia project, which has helped to sponsor today's event. As of today, there have been about 185 million cases of COVID-19 around the world since the outbreak, about 4 million deaths, and some economists project up to 11 trillion US dollars in damage from this pandemic. There's been a lot of focus, understandably, on vaccine rollout, a little more focus recently on preparedness for the next outbreak, but not a lot of talk about prevention. Today's event focuses on prevention in three parts, looking at what are the causes of pandemics, of zoonotic outbreaks. Secondly, what are some ways to prevent these outbreaks from happening in the first place? And thirdly, what are some specific tools that are available right now to ASEAN and the world to prevent pandemics from happening in the first place? So I would now like to go to the chair of today's event, Madam Secretary General of the ASEAN Interparliamentary Assembly, who comes to us from Jakarta. Madam Secretary General, the floor is yours.
Thanks, Steve. Good morning, good afternoon to everyone. Distinguished parliamentarian of AIPA Member Parliament, dear Mr. Steve Ganster, International Chair, Executive Director of the Freeland Foundation, representative from international regional organization and financial institution. Ladies and gentlemen, first of all, please allow me to extend to you my warmest greetings and welcome all of you to a webinar jointly organized by AIPA and Freeland on preventing pandemics through One Health approach. This webinar will focus on the root causes of the COVID-19 pandemic and promoting long-term solutions to prevent a future pandemic while ensuring a safer and healthier environment through One Health approach. One Health approach is a global approach that merges expertise, goals, and resources in human health, in animal health, and in ecosystem health in order to detect and prevent the emergence and spread of a new pandemic. Ladies and gentlemen, the ASEAN Interparliamentary Assembly, consisting of member parliaments from 10 countries in Southeast Asia, has reinforced the region's commitment to combat cross-border crime and significantly had included trafficking of wildlife, putting them on par with other major international transnational crimes such as drug trafficking, human trafficking, terrorism, and arms smuggling. Together with governmental efforts supporting the harmonization of environmental laws to combat transnational crime and wildlife crime, AIPA General Assembly has approved resolution to strengthen law enforcement and regional cooperation in order to combat wildlife crime. AIPA also in coordination with its external stakeholders, especially with Freeland, our long-term MOU partners of AIPA, has conducted consultation on efforts to counter wildlife trafficking. This cooperation encouraged AIPA member states to employ legislation and policy as tools to combat wildlife trafficking. Distinguished parliamentarians, ladies and gentlemen, this webinar is conducted at the right moment as our region is currently experiencing a serious COVID-19 pandemic spike, and all AIPA member parliament are struggling now to control the pandemic and to overcome this challenging time. I hope that with the active participation and valuable contribution of all AIPA parliamentarians as well as delegates, we will have an exciting and insightful meeting. On this occasion, I would like to sincerely thank all distinguished members of the parliaments, all keynote speakers for joining this webinar. Especially, I thank Mr. Steve Ganster for your effort in organizing this important event. Ladies and gentlemen, now I have a great pleasure to invite each AIPA member of parliaments that sent MP to this webinar to briefly introduce your delegations. Due to a time constraints, each country is given half a minute to speak. Now I have a great pleasure to invite the first country, Brunei, which is followed by Cambodia. So Brunei, you have a floor.
Thank you, Madam Chair. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and good afternoon. Honorable delegates, ladies and gentlemen, on behalf of the Legislative Council of Brunei Darussalam, I would like to express my appreciation to the Secretariat of AIPA and Freeland organization for the invitation to this webinar. I am Khairunisa Ash'ari, member of the Legislative Council of Brunei Darussalam. I am accompanied by Pihin Dato' Haji Judin, Secretary to the Cabinet Ministers Council and Clerk of Councils of Brunei Darussalam. We look forward to the sessions lined up and to participate in the discussions later. Thank you.
Thank you, Brunei. To invite Cambodia. Cambodia, you have a floor.
Hello, AIPA delegate and Madam Secretary AIPA. I am Q. Perez, is a Secretary of the Commission on Education, Youth, Culture, Sport, Religion, Affairs, Culture, and Tourism, Head of Delegate. On my right side is Excellency San Sarana, Member of Commission of Planning, Investment, Agriculture, Rural Development, Environment, and Water Resource, Member of Delegate. Thank you.
Thank you, Cambodia. Can I invite Indonesia? Indonesia, you have a floor.
Of AIPA, Member Parliaments, Secretary General of AIPA, Mrs. Nguyen Chul Phat, distinguished panelists, moderator, Mr. Stefan Galster, ladies and gentlemen, good afternoon from Jakarta. It's a good opportunity for me to be able to participate in this webinar on crucial topics and introduce the delegations of the House of Representatives of the Republic of Indonesia attending this webinar today. First, my colleague, Honorable Mr. Darul Siska, from the second biggest party, Functional Group Party, or Golkar Party. West Sumatra is his constituent. He is member of the House Committee for Interparliamentary Cooperation and also member of House Commission 9, dealing with health, manpower, and demography. Second is me, Yohanes Franciscus Lema, from the ruling party, Indonesia Democratic Party for Struggle, the so-called PDIP. Nusa Tenggara Timur is my constituent. I am member of the House Committee for Interparliamentary Cooperation and also member of the House Commission for dealing with agriculture, maritime, environment, and forestry. Thank you.
Thank you, Indonesia. Now I would like to invite the head of delegation from Lao PDR.
Good afternoon.
Thank you.
Honorable Chairman, Honorable Secretary General of AIPA, distinguished parliamentarians. On behalf of the delegation of the National Assembly of Lao PDR, I would like to express our sincere thanks to the AIPA in cooperation with Freeland for arranging this special delegation meeting. Please allow me introduce myself, Bulom Kiabahom, Vice Chairman of Socio-Cultural Affairs Committee of the National Assembly of Lao PDR, and Lao delegates. Right hand is Mr. Elawan Pan Chavong, and our staff attend this visual meeting today. Thank you.
Thank you, the head of the Lao PDR delegations. Now I would like to invite the head delegation from Malaysia.
Hello, good afternoon, Madam Secretary General, distinguished panelists, members of parliament, ladies and gentlemen. My name is Dr. Kelvin Yee Lee Wen. I'm the chairperson of the Parliamentary Select Committee of Health, Science and Innovation in Parliament Malaysia, as well as the Member of Parliament for the constituency of Bandar Kuching in East Malaysia. So we are very happy to be part of this conversation, and together, I think this is a topic that we can work together as a whole to deal with this global pandemic. Thank you so much.
Thank you, Malaysia. Now I have a pleasure to invite Philippines.
To the AIPA Secretary General, Honorable Nguyen Tung Van, Freeland Chairperson Steve Gassler, my fellow members of Parliament present here today, and to the AIPA Secretariat, good afternoon. I am Honorable Angelina Helen Tan, a district representative from Quezon Province, Philippines, and current chairperson of the House Committee on Health. I am also the co-chair of the Asia Pacific TB Caucus and the Philippine TB Caucus, and a member of a global TB Caucus Executive Committee. Aside from being a parliamentarian for 8 years now, I am also a nurse and doctor by profession. Thus, I very much look forward to this webinar and express my gratitude to the organizers for hosting this event in order for us to gain more knowledge in handling not only COVID-19 pandemic, but future pandemic as well. So thank you very much on behalf of the Speaker of the House from the Philippines for the invitation, and I hope that we'll have a fruitful and engaging virtual gathering today.
Thank you, distinguished parliamentarians from Philippines. Now I have the pleasure to invite a member of the parliament from Vietnam to introduce yourself.
Good afternoon from Vietnam. Ladies and gentlemen, Secretary General Mrs. AIPA, Nguyễn Tường Vân, may I introduce myself? My name is Đình Công Sĩ, member of the National Assembly of Vietnam. It's the first time I attend the meeting that cooperate between the AIPA and Freeland. I myself thank you very much, Secretary Mrs. Nguyễn Tường Vân and the Freeland for giving me a chance to engage in this webinar. I believe that we will have a fruitful webinar and looking forward to face-to-face meeting in the near future after the pandemic. Thank you.
Thank you, Vietnam. So thank you all parliamentarians for your nice introductions. I'm also pleased to inform you that we also have some representatives who are not MPs joining this webinar from Myanmar, from Canada, European Parliament, New Zealand, and the Republic of Korea. So thank you all for your attendance. Ladies and gentlemen, to continue our agenda, it is my great pleasure to invite B.Grimm Chairman Dr. Harun Ling to speak about ASEAN business perspective on pandemic prevention in ASEAN. I also want to share with you that Dr. Harun Ling is the Ling first generation leader of B.Grimm Group, established in 1878 in Thailand, a multinational conglomerate with businesses across energy, building and industrial system, healthcare, transportation, lifestyle, real estate, digital, and capital partners. He has been in the B.Grimm Group for over 30 years. And under his leadership, B.Grimm Group continued to set its sights on the future while holding true to the company core value of doing business with compassion for the development of civilization in harmony with nature, based on its value of positivity, partnership, professionalism, and pioneering spirit. So now I would like to give the floor to Dr. Harun Ling. You have the floor, Dr. Harun Ling. Thank you.
Thank you very much, Madam Secretary of the ASEAN Inter-Parliamentary Assembly. I don't have to say anything anymore. I've already introduced B.Grimm so well. Thank you so much for that.
Thank you.
And distinguished Chair from Brunei, thank you very much for this opportunity. I think we all agree that there are not many greater causes in our lifetime than to prevent the next pandemic. I mean, the damage has been so extensive. So I'm very glad to see that so many of you distinguished members of the Inter-Parliamentary Assembly are here today to exchange information, ideas, and find ways how to prevent the next one. B.Grimm and our partner ADB, we are invested in a number of ASEAN countries. And of course, we wish prosperity, good health for all of us. And as Your Excellency, Madam Secretary already mentioned, so B.Grimm purpose is to do business with compassion. And we have been in the healthcare business since 143 years, and in clean energy, like in Cambodia and Vietnam, starting now in Indonesia, and have been doing it in Thailand for a long time. What we also do is we support the tiger conservation, because we like to have a healthy system of our national parks. And our national parks are constantly in great danger because people look for short-term gain and they try to build something in these parks just for short-term gain of some very limited number of individuals. So we now became quite actively involved in pandemic prevention. And I think we all have suffered tremendously from COVID-19 and are still suffering from it, and maybe have to find a way how to live with it. So we'd love to see if we can all work together closely, whether it's government or private sector, whether it's national companies or whether it's individual businesses, to prevent the next pandemic. And so B.Grimm also joined this EndPandemics campaign, and we are very glad that Freeland is doing all these efforts to make people aware of that. And I think we all know that no matter where you think this disease might come from, that pandemics, they originate from animals. And there are many more millions of viruses waiting in the jungle in case people continue to get these animals out of the jungles. And the destruction of wild habitat and the commercial trade of animals are really the causes. And so, since we all want to prevent the next pandemic, I think it's really important to put a stop to this commercial trade of wildlife. Let the animals be where they are now. Let them have their limited space. We have taken away so much of their space already. Let us find some good occupation in other ways rather than trading wildlife. And let maybe the government support those who are active in legal part of it, have some other education and some other occupation, help them to change from what they're doing now to go into better life for wildlife, better life for us all. So we will do our best to join in doing that. And we're also glad to have access to the roadmap to EndPandemics, and I think we can all benefit from reading it. And I hope that we can all join to try to prevent. I'm talking a lot to newspapers, to television channels, and ask the press to be really aware of it and do their part, because when I read papers, I actually practically never read anything about prevention. I only read about how to get hold of vaccinations, and I think that's not good enough for the next one for sure. So I hope we can all join together in preventing the next pandemic, and we, as B.Grimm, as a company, we are very ready to support any cause that is going in that direction. Thank you very much for listening, and thank you for having me here.
So thank you, Dr. Harold Ling, for your remarks, and we highly appreciate your leadership in the B.Grimm Group in the effort to support our combat against the commercial trade of wildlife, as well as to contribute to the prevent of the outbreak of the similar future pandemic. So thank you very much for joining our webinar, and we look forward to have a very interesting discussion with you.
Thank you.
Thank you very much.
Thank you so much.
I'd like to give the floor back to Mr. Steve Dunster. Thank you.
Thank you, Madam Secretary General, and thank you, Dr. Link, for reminding us of the business perspective, but also business with compassion, which we know has been the motto from B.Grimm, that there is no good business in a pandemic. So we are now going to show just a short 2.5-minute video which will set the scene for some of the subject matter experts that we're going to listen to today. We have some fantastic experts on this subject, but let's roll the video now before we go to our first SME.
COVID-19 has changed our world, the way we live, our economy, our health systems, everything. COVID-19 will not be forgotten. To make sure that we never go through this again, we have to understand why it happened. COVID-19 and other zoonotic outbreaks were transmitted to people from wild animals that were taken from or pushed out of their natural environment. Some transmitted the virus directly to people, while others transmitted it through domesticated animals, including livestock. This is not the first time. SIV jumped from a primate to a human and then became HIV. SARS jumped from a civet being sold on a menu. MERS from a camel. Bird flu jumped from wild birds. Ebola from bats. There are countless other viruses in nature waiting to be unleashed if we don't change our relationship with nature. Experts agree. Rising commercial wildlife trade, industrial farming, and dwindling wilderness have brought people into closer, unnatural contact with wild animals. ASEAN member states can safeguard against future pandemics by addressing these root causes, by resourcing the protection of wildlife populations inside their natural environments, by supporting demand reduction campaigns, by introducing strong laws against wildlife poaching and trafficking, by resourcing the enforcement of those laws. A new medical cure for COVID-19 will not work against the next virus. Stimulus packages will amount to expensive band-aids that need frequent changing if we do not address the root causes. Let's bring ASEAN society together to prevent more outbreaks through nature protection, as if our lives and economy depend on it.
Let's now go to Dr. Ronello Abila, who is our first speaker in the section of How Do Pandemics Start? Dr. Abila is the sub-regional representative from Southeast Asia for the World Organization for Animal Health. Dr. Abila comes to us from Bangkok today. Dr. Abila, the floor is yours.
Thank you very much, Steve, and thanks to AIPA for inviting me, and also from Freeland for inviting to join me in this webinar and to share our expertise on this aspect. So I'll be presenting the origins of zoonotic outbreaks, and it's very related to what we have just seen in the video. So where is the source of pandemics? As already indicated in the video, start from the wildlife, as you can see here. And from the wildlife, it's interaction with domestic animals and with the people. And with all this interaction, that's where all these zoonotic diseases come from. It has been established that 60.3% of emerging infectious diseases in humans have an animal origin, and the majority of these are from wildlife. Interaction, increasing interaction of the human-animal ecosystem interface has been really one of the biggest risk factors among these. Zoonotic diseases. Zoonotic disease from wildlife, as a okay, I hope it's much better now. Okay, so as I've seen in the previous slide, diseases coming from wildlife, it got interaction with the domestic animals through direct contact or through vectors that are biting flies or ticks, and then where the spillover starts. And also from the intermediate host, from the domestic animals or other species that might also cause the transmission to human, or direct transmission from wildlife is going to the human population. Some of the examples we had during the past few years, the very first one in our region that caused really I would say an alarm was in 1998, 1999, when the Nipah virus affected some pigs in Malaysia, and from pigs it infected humans because of the interaction between bats in the population where there's a close interaction between bats and piggeries. Then there was a spillover and it really caused an outbreak. And there was a delay before it was detected because they thought that it was a Japanese key encephalitis and Nipah virus was not known before. So it took them around 6 months before this new disease was detected. And then in 2003, 2004, the first detection of H5N1, a zoonotic avian influenza coming from wild birds, and then it goes to the domestic birds and also affected people. So in total, until 2020, the WHO has recorded more than 800 people has been affected with H5N1. We are lucky because with this influenza, avian influenza H5N1, it did not really cause a pandemic. During that time, there was really an alarm because we thought that the next pandemic will be coming from avian influenza. Similar to the 1917-1918 Spanish flu. That's why when this appeared, many of the governments really took it seriously, and that's what really triggers with the. Later on, I will be explaining the concept of One Health that was formulated. Now I'll continue with some slides on coronaviruses, which is one of these, the zoonotic coronavirus coming from bats, where this current COVID-19 come from. But not all coronaviruses from bats are zoonotic. And the most important are the 3 coronaviruses that we have seen the past year. The first one in early 2000 was the SARS-CoV, the first SARS. And then the MERS, the first SARS, it was identified that from bat goes to the civet animals. And then for MERS in the Middle East, the intermediate hosts are camel. But for the current SARS, the COVID-19, until now, it's still unknown and it's ongoing investigation. These are the areas where most of the bats are located in Southeast Asia. And having this bat population will always pose a continuous risk between the interaction among bats, domestic population, animal population, and the human interaction with them that will be expose them possibly to new viruses come from them. And in one study in the southern part of China, the one in red triangle, it has been found that some people living near bat caves, 0.45 to 2.9% of them has seropositive reaction to some of these bat viruses. They are asymptomatic, no clinical signs, but they have this antibodies. So it seems that there are already, it proves that there are interaction between the bat population in those areas and some people there. This map shows some of the diseases that has been detected carried by bats. Ebola in Africa, MERS in Middle East, the Nipah in Malaysia, SARS, the first SARS in China, and Hydra virus affecting horses in Australia. Some of the examples of zoonotic wildlife diseases, there was a very comprehensive literature study in 2017. I provided here the link. You can access this. There's a wide range of pathogen species that you can find from wildlife species. During the past several decades, there are this slides show how much were the impact of these zoonotic diseases. For example, the H5N1 in 2004, it was estimated that it cost around $3.3 billion in poultry industry. And for bovine tuberculosis, for Ebola in Africa, and the MERS in Middle East, the Nipah virus in Malaysia, it cost around $41.5 billion. And it was just a confined epidemic of the first SARS. For COVID-19, we still don't know how much it will cost, but definitely it is one of the worst epidemic that has happened in our century, and we still don't know how much it will cost us. The OIE has been monitoring COVID in animals, and if we are lucky that not so many animals can transmit the virus from animals to humans. So except for some indication in mink farm in Netherlands and in some parts in Europe, that's why they have stamped out many of the mink farms there. And mostly the cases are human infected with COVID infecting animals. But most of the animals are not susceptible, at least for food producing animals, are not susceptible, like pigs and poultry, they are not susceptible to COVID. So with this infection of wildlife in farm wildlife, so the OIE has come up with these guidelines on how we could prevent it. And looking at the supply chain, the risk factors on the wildlife supply chain, and as mentioned already, the very first from the supply chain is coming from the wildlife with this illegal destruction of forests, the habitat, and disrupting the natural habitat of the wildlife, then it will really cause this interaction between this wild species with the domestic animals and the people, and causing this spillover. So this is the supply chain that if we want to reduce the risk, of course, we have to start from the very start, is to reduce the habitat destruction and to come up with some regulation in the wild animal control and improve animal life collection hygiene and so on and so forth until it reaches the end of the supply chain. For this, the OIE has come up with the Wildlife Health Management Framework, and we have launched this strategy and to be working with the various sectors, with the human health sector, with the environment sector, with the other government agencies, the private sector, and other research institutions to implement in managing the risk of spillover of pathogens between wildlife, domestic animals, and human. And to implement this, the tool that we have adopted since 2008 is the One Health approach. Okay, it's a global strategy for preventing and managing the risk of human-animal ecosystem interface. As early as 2004, some scientists and professionals have already defined Campaign for One Health. They have defined it as a collaborative effort of multiple disciplines working locally, nationally, globally to attain optimal health of humans, animals, and our environment. And it was in 2008, after the outbreaks of H5N1, that really triggered government, ministries of health, agriculture, foreign affairs come together during the interministerial conference in Egypt in 2008 to adopt the One Health approach. This is the first time at the global level that the FAO, OIE, World Health Organization, UNICEF, and World Bank adopted and endorsed the One Health approach. And in 2010, the tripartite, the FAO, OIE, and WHO come up with this document for the prevention and control of emerging zoonosis and declare this as a public good, and shifting focus towards good governance and national health systems strengthening instead of short-term ad hoc intervention. And this is further strengthened. The tripartite had renewed its agreement in 2018 after the launching of the global strategy for antimicrobial resistance, because that's another area where they have to work to prevent pandemics coming from resistant bacteria. So we have renewed this agreement, the alliance of the tripartite. And in November 2020, the United Nations Environment Program, the UNEP, has joined with the tripartite in working for a One Health approach. In Asia, we have been working on it, and we have conducted a series of workshops with representatives from governments, ministries of agriculture, health, forestry, and research institutions, and other partners every 2 years to really come up with recommendations recommendation on how we could further strengthen the implementation of One Health in Asia. What are the current challenges in implementing One Health approach? I would say at the country level, the compartmentalized mandates of government agencies is one of the blockade that we could not smoothly implement One Health approach. Ministry of Health, as per their mandate, is focused on human diseases, but they lack that mandate to control zoonosis at the source, which is at the animal source. While the Ministry of Agriculture, its main mandate is to control livestock diseases that is for food, for production, but they don't have also the resources or that strong mandate to control zoonotic diseases. One example, even for the control of rabies in dogs, many of the Ministry of Agriculture, they don't buy vaccines for rabies because they said it's not their mandate because dogs are not animals for food. So that's also another challenge. And for the Ministry of Environment and Forestry, there's a lack of mandate to control wildlife diseases. Some bureaus or agencies under Ministry of Environment, they say that their main mandate is for conservation, but they don't have the mandate to control or to monitor diseases. So with that, it seems that we really need a strong institutional One Health coordination mechanism with proper human and financial resources to support in implementing a One Health approach, including the different agencies. So we need a legislative support to have a One Health legislation providing policy and resources to be able to implement the One Health approach in our region. So in my slides, last slide, I would say that the way forward is to stop pandemics. Let's focus in controlling the pandemics at the animal source. And one of the best way to reduce it is by reduction, the destruction of wildlife habitat. Okay. And we need to strengthen One Health approach in addressing complex health threats. And we have to focus in strengthening health systems both in the human health and animal health and environmental health to prevent and control pandemics. Thank you very much.
Thank you, Dr. Abila. We're very lucky to have Dr. Abila with us today. He's a renowned scientist. He's just spoken to us about zoonotic outbreaks, the origin of zoonotic outbreaks. And I'm sure some of you know, as we saw in the slides there, that the World Organization on Animal Health has been relied on quite a bit for expertise during this pandemic. So we're very fortunate to have had your intervention today, and I know you will be sticking around for the questions and discussion session. So thank you very much for setting the scene for us on the origins of zoonotic outbreaks. We're now going to go to Switzerland. We're also very lucky to have another speaker with us today, Mr. John Scanlon, who is the former Secretary General of the Convention, UN Convention on International Trade in Endangered Species of Flora and Fauna. John wears many hats now, one of which is the CEO of a campaign called EndWildLife Crime. John, the floor is yours. You're going to be speaking to us about reducing the threats of zoonotic outbreaks from wildlife trade. Thank you.
Great, thank you, Steve, and thank you to AIPA and Freeland for hosting today's important event. And good morning and good afternoon to Madam Secretary General and all distinguished participants. If we look back to this time last year, I'm sure we all thought we'd be coming out of this COVID-19 pandemic by now. Unfortunately, that is not the case, and we see governments continuing their tireless efforts to stop it from spreading and to vaccinate us against it, as well as endeavouring to better understand its origins. At some stage, we will get through it, but when we do, it won't be over. In fact, far from it. I think you're probably familiar with the recent World Health Organization report, which says the most likely explanation for COVID-19 is that the virus jumped from an animal, such as a bat, to humans, possibly via another animal. And while it's still too early to draw any final conclusions about the origins of COVID-19, we're all increasingly aware of the links between wild animals and previous epidemics and pandemics, as well as the conditions that make the spillover of viruses from animals to humans more likely. As Dr. Abila has just explained very well, and is graphically illustrated in your excellent video. Health and wildlife experts warn us of the public health risk associated with people mixing with wild animals, including through habitat destruction, illegally or poorly regulated wildlife trade, and through the sale of wildlife at markets that bring together wild, captively bred and domesticated animals. But in saying so, we must also be mindful of the fact that when left alone, wild animals pose no risk to human health. The risk comes from how we, as people, interact with wildlife, and that is something we can manage. And it's not just the health risk we need to be concerned about. In addition to these risks, the UN IPBES predicts that due to our actions, over 1 million species will go extinct over the coming decades as a result of overexploitation, including for illegal trade, and the loss of wildlife habitat, amongst many other threats. Unless, of course, we change course. Climate change is at the top of the international agenda. And one response to help climate change or to mitigate climate change is nature-based solutions. They can offer about 1/3 of the carbon dioxide mitigation needed to 2030. Yet habitat loss and the overexploitation of wildlife, including through illegal trade, degrades ecosystems and their ability to sequester carbon. This pandemic has reminded us, albeit in a devastating way, of the interconnected nature of things, most particularly between economies, the environment, human and wildlife health and welfare. We need to recalibrate our relationship with nature for many compelling interrelated reasons, including to protect biodiversity, combat climate change, and to prevent future pandemics. This is going to require profound changes in how we regulate the taking, trade, and consumption of wildlife, how we combat wildlife crime, and how we manage and finance the protection of wildlife at its source. EndPandemics has produced a comprehensive roadmap that identifies a wide array of risk and recommended actions to avoid spillovers and prevent future pandemics. Today, I'm going to briefly touch upon two issues, namely wildlife trade and wildlife crime. As Steve mentioned, I'm fortunate to chair the global initiative to end wildlife crime, through which a diverse array of people and organizations have joined forces to promote certain changes to our international laws. Our initiative considers that the current international regime for regulating wildlife trade and combating wildlife crime is inadequate in setting the framework for regulating the trade, markets, and consumption that pose a risk to public health, as well as for ending wildlife crime. And we're promoting changes to the existing international legal framework that will enshrine into law agreements between states on how they will work together to help prevent future pandemics and end wildlife crime, and in a manner that delivers multiple local and global benefits. Let me share with you our concerns about the existing international wildlife trade and wildlife crime laws in a little more detail and briefly outline our suggested reforms. Our starting point is that these are challenging, global, interconnected issues. Viruses can spill over in any country, and wildlife crime is a scourge affecting every continent. And while countries can always act alone, effectively tackling these risks will require a collective response. And as such, it's preferable to agree upon and to follow a common set of rules to address the risk of pandemics emerging from wildlife trade and wildlife crime from anywhere, both now and into the future. Firstly, on wildlife trade, the global agreement that exists to regulate international trade in wildlife, known by its acronym CITES, takes decisions based solely upon biological and trade criteria. It looks to see if any trade will affect the survival of the species of animal or plant that is being traded. Does not pay any attention to the risk that such trade could pose to human or animal health, nor does it address wildlife markets. This needs to change. Regulating wildlife trade needs to be based on a One Health approach, where biological, human health, and animal health criteria are all taken into consideration. And we're already starting to see some states impose further restrictions on trade and markets. For example, in China, Gabon, Italy, and Vietnam, which is very positive. And the WTO, OIE, and UNEP have called on national authorities to suspend the trade in some live caught wild animals for various purposes and to close sections of food markets as an emergency response. But to be successful, we need to encourage a collective effort and to recognize that human memories are short, as is clear from the responses to previous pandemics. To succeed, we must hardwire a One Health approach into the agreed international legal framework, which in turn will be reflected in national laws. And I'll briefly touch upon two options to achieve this objective. States could adopt amendments to CITES that build human and animal health criteria into its decision-making processes and to extend its reach to wildlife markets. However, CITES parties have traditionally been wary of extending its mandate, and they may elect not to take up this opportunity. There is, however, another viable option, and this comes from an initiative of the global health community. And it's to ensure that the scope of a proposed international pandemics treaty includes legally binding commitments on taking measures to prevent the spillover of viruses and other pathogens from wild animals to people, including through wildlife trade and markets. And doing this would institutionalize a One Health approach now and into the future. And we've released a short briefing paper on this option, which we've shared with the WHO as it assesses the possible benefits of such a treaty. Secondly, moving on to wildlife crime. In addition to posing a threat to human and animal health, wildlife crimes are driving many species towards extinction, degrading entire ecosystems and their ability to sequester carbon. They're depriving governments of up to $12 billion in revenue a year. It's exacerbating corruption, insecurity, and poverty. And if we look at all species being illicitly trafficked, not just the limited number of species regulated under CITES, and include the impacts of these crimes on ecosystems, then the World Bank estimates their value at a staggering $1 to $2 trillion a year. Further, as more restrictions are imposed on certain wildlife trade and markets, it will require an enhanced collaborative enforcement effort to ensure such activities do not move underground. Now, notwithstanding the destructive and high-risk nature of these crimes to both people and wildlife, there is no global agreement on tackling wildlife crime, as there is, for example, on human trafficking. And in the absence of any alternative, we have, to date, relied heavily upon CITES, which is a 50-year-old trade-related convention, and it's not a natural forum for police or other enforcement officials. Enhanced global connectivity, the ability of organised crime to operate across international borders, and the trafficking of wildlife at an industrial scale requires enhanced global cooperation and national responses to tackling wildlife crime. It's time to embed combating and preventing these crimes into the international criminal law framework. And we've released a working draft on the possible form and content of a new global agreement on wildlife crime to advance the discussion. The draft has many elements, including setting out the conduct to be criminalised and committing states to make it a criminal offence to import any wildlife that is acquired in contravention of the laws of the source country, representing an expression of comity between nations or a mutual respect for one another's laws, and on the exchange of critically important information, including forensics. It would apply to any species of wild fauna or flora, including fish and timber, that is protected under any international or, importantly, any national law. So it would extend well beyond CITES-listed species and include the millions of species that are not listed under CITES but may be illegally harvested and traded internationally, as is frequently the case with timber and fish trafficking. And I'm delighted to inform you that in May of this year, the President of Gabon, His Excellency Ali Bongo Ondimba, and the President of Costa Rica, His Excellency Carlos Alvarado Quesada, presidents of two biodiverse rich countries, jointly called for a new global agreement on wildlife crime, taking the form of a fourth protocol under the UN Convention Against Transnational Organized Crime, and they are reaching out to other states to join them in this endeavor. Distinguished participants, the world is still feeling the full brunt of a pandemic, which most likely had its origins in a wild animal. We're advised that there are hundreds of thousands of new viruses that could spill over from wildlife to humans. We're struggling to combat climate change and staring down the loss of 1 million species. Given the scale of the risk to people and the planet, we must ratchet up both our national and global responses to these threats. And if we get it right, the local communities living amongst wildlife, legitimate investors, and the governments of source countries, as well as our global biodiversity, climate, health, and security, will all be beneficiaries. I'd like to finish my presentation today by sharing a short video with you that captures the reasons why the presidents of Costa Rica and Gabon have called for a global agreement on wildlife crime. I'd like to thank you for the invitation to join you today, and I hope you enjoy the video. Thank you.
Thank you, Mr. John Scanlon, coming to us from Switzerland today. Mr. Scanlon, the former Secretary General of CITES, now the chair of the EndWildLife Crime Coalition, speaking to us in our session about prevention, mentioning the measures that would institutionalize a One Health approach, as we also heard from Dr. Avila, and also, very importantly, a new global agreement to prevent and combat wildlife crime, possibly by amending the UN Convention Against Transnational Organized Crime. John, thank you very much for your intervention today. We know you will also be available for the Q&A session that is coming up shortly. So, as we are in session 3, which is on preventing pandemics, 3 out of 5 sessions, each brief, we now go to Andrei Kushlin, who is the policy lead for the EndPandemics campaign. Andrei is a former World Bank and UNFAO manager. Andrei is coming to us today from his home city of Moscow, Russia. Mr. Kushlin, it's over to you.
Thank you so much, Steve. Let me make sure I can share my screen. Here we go. Yes, good afternoon, Madam Secretary General, honorable representatives, colleagues. Today I have the distinct pleasure of presenting to you Roadmap to EndPandemics, Building It Together. A document, a cover page of which you can see on the left side of the slide, and its internet location is at the bottom right of the screen. This is a collective product of the EndPandemics Alliance that I'll talk about in a second, and it is a living and interactive document. The version presented today will be continuously expanded and improved with next inputs coming from various target audiences and participants. It is intended for use by lawmakers and governments, community leaders and civil society groups, business executives, international organizations, donors, One Health practitioners, and simply concerned citizens. At the end of today's discussion, we will launch this document to a wider global audience for their feedback and engagement. So what's EndPandemics, who we are? It is a global campaign alliance that started in February 2020. As of now, we have over 80 participating organizations operating on all continents in various sectors: conservation, health, agriculture, technology, security, business, media, communication, and others. Our aim is to prevent future pandemics by addressing their root causes. And we focus on promoting and scaling up local solutions. The Alliance has an open and flexible governance that can suit any organization, big or small, formal or less formal. And it's never too late to join. Do make sure to explore our website on the bottom left side of the slide. Dr. Abila of the World Organization for Animal Health has already given us an excellent overview of the root causes of zoonotic outbreaks. This chart helps visualize the 6 stages of pathogen spread at the top rows from left to right, and the probability of the virus reaching each stage, as well as the cost of containment at the bottom row. As you can see, such probability is always high at the spillover stage and keeps getting higher with the increase in natural habitat fragmentation and wildlife trade. At the same time, the costs of primary prevention are very low compared to the costs of detection, containment, and especially control, mitigation, and recovery at the epidemic and pandemic stages. This is why we focus on primary prevention at the source. This chart is well known from the pre-COVID literature. It further illustrates how the cost of outbreak control measures grows exponentially as we move from pathogen emergence in animals to humans. We fully recognize the huge importance of investing in pandemic preparedness, shown by the blue arrow on the right. Such measures are essential for reducing downward costs of control and recovery through early detection and rapid response. But our emphasis is on prevention, a blue arrow on the left, as it helps flatten the curve of costs altogether by significantly reducing the risks of spillovers. Furthermore, prevention is not only a public health imperative. If you look at the main drivers of emerging infectious diseases on the right side of the slide, you will notice that the dominant factors are land use changes, food and agriculture industry changes, international travel and commerce, climate and weather. Addressing all these drivers is simply good development policy in any circumstances, as shown on the left side of the chart. I understand that Mr. Dunn from the Asian Development Bank will illustrate this fundamental point in more depth later today. Finally, here are some visuals on how global pandemic prevention costs that are certainly significant and measured in billions of dollars a year can compare to the global pandemic damages and recovery costs. A concerted 10-year effort to transform our relationships with nature and establish routine prevention measures will cost only 2% of the damages the world has already incurred as a result of COVID-19. Or you can say simply that your annual prevention insurance policy will cost you only 0.2% of the possible full treatment costs. Our roadmap for pandemic prevention is built on these 4 action pillars: reduce demand for wild animals, phase out commercial trade in wild animals. This is what John Scanlon has talked about already in good detail. Protect and restore natural habitats, and make our farms and food systems safer and healthier. Of course, they are closely interconnected and overlap, but each requires strong specialized expertise to develop effective solutions. Each also addresses certain interest groups and target audiences more than others. Solutions in every action pillar will only be effective in achieving sustained pandemic prevention impacts if they penetrate through these 4 impact levels: support frontline and community actions, change public policies, change business practices, change consumer behaviors. Combining these 2 dimensions, actions across and impacts down, we have arrived at what we call a solutions map. It allows for any practical pandemic prevention solution from any jurisdiction, geography, or socio-cultural context to be placed into a uniform grid. All solutions within a single map cluster may be different in their origin, ownership, and progress, but all of them will have important common features that will help compare their progress and impacts using a common set of indicators. They will also learn more easily from each other's individual successes and setbacks. Finally, this map helps keep track of the expansion of various interventions and make sure all action pillars are covered and impacts are tracked at all levels, leaving no blind spots behind. The current situation, which is very hypothetically shown on this slide, reflects a very ad hoc and uneven distribution of pandemic prevention efforts. The EndPandemics Alliance has already started building a solutions map, sourcing them from our participating organizations and beyond. I'll quickly run you, just flip you through just 4 examples, each illustrating 1 action pillar. And you don't need to try to read them on screen, as you can review them later among the 9 solutions featured in our roadmap document in the appendix. Another solution is showing conservation litigation measures, and it has been tested in Indonesia, and it reflects a stop tracking pillar and the consumer behavioral change impact. Another one is also coming from Indonesia on mitigating human-wildlife conflicts, sourced from the UNDP Sumatran Tiger Project. And it is addressing protect nature pillar and looking at the impacts at the level of policy changes. Yet another one is on implementation and scaling of community restoration of degraded lands. This one has been tested and sourced in a number of African countries, but can be replicated across all tropics and subtropics. And it's addressing our reform farming pillar and looking at the changing business practices impact level. So these are part of a larger database of solutions where new entries are being submitted and peer reviewed every week. So as we move from individual solutions to populating our solutions map, we look at a process of moving from the small bottom map, which is very ad hoc and incomplete, to massive coverage above, which is covering all pillars and all impacts. One of the challenges of every implementation agency across the world, whether it's international or national or regional, is often that it's not so much a shortage of funding, but a shortage or lack of bankable projects. Those projects that can be delivered on the ground and that will have the staying power after the specific project intervention is over. So we are, through this solutions map, we are really helping increase the ownership of solutions because they are sourced from the ground and improve their sustained implementation. By moving them all into this platform that can be easily promoted through various communication channels, we improve the visibility of each individual solution and increase their transparency. Each cluster of solution results in a community of practice that helps sharpen the existing solutions, learn from each other, and develop better and more practical progress indicators. It also helps then result in better impact verification by those who support those actions, whether it's governments or international donors or private investors. The new brave world of fintech tools is now emerging, and we have members in our alliance who have a very strong facility with those tools to enable to better track individual efforts and impacts and reward them. And finally, by clustering these similar solutions together in big classes of solutions, we can help build what one can call a solutions exchange, similar to stock exchange, that can help mobilize impact investments. Finally, why should you be interested? What's in it for me, for you, for a lawmaker, policy advocate? It can be many things. One of them is simply to validate your own policy proposals and help gain local buy-in, not only in your own constituency, but much broader. For governments, they can use this mechanism for finding credible pilots in their program delivery, whether it's One Health programs or other green recovery programs and whatnot. International organizations will expand their access to local knowledge and partners. For those in the front lines, local communities, people working as social entrepreneurs, this mechanism and the roadmap will grow the visibility and market value of their solutions, of their individual solutions. And the list can go on. Business executives can be more successful in testing their new products or services to gain local buy-in. The bottom line is we are open for everyone to join, from large to small organizations, formal and informal. And the red link at the bottom is how you enter our alliance. Thank you very much. Back over to you, Steve.
Thank you. Thank you, Mr. Kushlin, who came to us, is coming to us from Moscow today. Mr. Kushlin, formerly of the World Bank and UNFAO, and currently the policy lead for the EndPandemics Campaign Alliance, who's just summarized the roadmap to EndPandemics, which was published and released just today and has been distributed to all of you on this call. If you're still looking for it, it's a roadmap that was just created. It's in English, but there are other languages that are being produced as well. It's a very rich document that talks about everything that we've heard about today and has had expert input from around the world. We've also heard from Mr. Kushlin about the open invitation to build up the solutions map that it contains and refers to, as this must be a global cross-border collaborative movement to prevent the next pandemic. Just a few weeks ago, EndPandemics in Freeland organized an event with the Thai government. And we would just like to show a brief video now from one of the ministers from the ASEAN member states. This is the Minister of Environment, Minister Silpa Archa from the Ministry of Natural Resources and Environment of Thailand. If we can go to that video now. We are showing this because we feel like he summed up pretty well from a ministerial point of view what we're talking about today with regard to the One Health approach and its connection to wildlife and nature.
A very good morning to you all. During the last century, people have increasingly encroached upon the natural world, resulting in escalating levels of contact between humans and wildlife. Many people around the world rely on the wildlife for their livelihoods and to meet their basic needs. As a result, the frequency and number of new zoonotic diseases have risen drastically. Over 70% of the emerging infectious diseases, or EIDs, in humans have originated in animals. These EIDs pose a grave threat to human health, causing deadly pandemics including HIV, AIDS, SARS, H5N1, H1N1, and most recently, the COVID-19. It had been confirmed that on May 20th, 2021, more than 160 million people around the world are infected by the COVID-19 and more than 3 million people dead. The COVID-19 crisis exemplifies the devastating costs of global pandemics. Beyond these devastating costs, the same driving force is also exacerbating the current planetary emergency of nature loss and climate change, putting the health of current and future generations at risk. The COVID-19 crisis significantly proves that systemic changes is crucial. Meanwhile, it has demonstrated the power of global responses to drive forward the systemic changes with unprecedented shifts in people's daily routine, from wearing masks, regular hand wash, respecting social distancing. In certain countries, including Thailand, hundreds of thousands of people volunteering to support the crisis response. It is a remarkable opportunity to work together to address the unsustainable pressures that are being placed on the environment. Ladies and gentlemen, recognizing the effects of environmental factors on human health, the global community has adopted the One Health approach to collaborate among multiple disciplines, working locally, nationally, and globally to address health for people and animals, as well as a healthy environment. The approach illustrates that whether tackling environmental issues or health crisis, solutions must recognize the deep interrelation of different systems. It also reflects close collaboration among stakeholders in animal and human health sectors. Thailand has also adopted the One Health approach since we have been hit by H5N1 in 2004 and H1N1 in 2009. To date, attempts to ensure human and animal health security, as well as the sustainability of the country's environment, have made some progress. However, commitments from all stakeholders, trust and effective law enforcement at all levels are crucial, especially when coping with the COVID-19 outbreak. I sincerely believe that the root causes of the outbreaks, not only the COVID-19, but also other zoonotic diseases, need to be addressed. It is hypothesized that there is a linkage and relevance between wildlife and the EIDs, including COVID-19. The Ministry of Natural Resources and Environment has a strong determination to protect not only Thai people, but also our wildlife, natural ecosystems, as well as the environment. The ministry aims to make Thailand free of the illegal wildlife trade by collaborating with all stakeholders, including businesses and local community, to fight against illegal wildlife trade. Campaign on refraining from consuming meat from wild animals, particularly from illegal hunting and trading, have been undertaken through the motto "Stop Disease and Extinctions, Never Eat, Buy, Hunt or Sell Wildlife." We have been working with the Ministry of Public Health based on One Health approach by following up, monitoring and controlling diseases transmitted from animals to human, both EIDs and REIDs. The ministry is also well aware that wildlife trade laws are important, as they can help prevent not only the illegal wildlife trade, but also the possible spread of the viruses. Therefore, the 2019 Wildlife Conservation and Protection Act has been formulated and entered into force in order to enhance protection levels of endangered species. The penalties, both in terms of fine and imprisonment, have dramatically increased. For example, the minimum fine of reserved species is over $9,000, while the imprisonment term is more than 10 years. I believed that the penalties for the illegal wildlife trafficking in Thailand now are amongst the strongest in the region, which hopefully can serve as effective deterrents for wildlife crimes. Nevertheless, law enforcement on illegal wildlife trafficking alone may not be sufficient to address the zoonotic diseases problem, as we realize that destruction of wild habitat forces wild animals into human territory, where zoonotic diseases can be transmitted from animal to people. We have introduced the approach on preservation of wildlife habitat in order to isolate the wild animals from humans by demarcating the area of national parks, wildlife sanctuaries and wildlife non-hunting areas, which covers around 17% of the country. The enactment of the 2019 Community Forest Act is also a strong societal driving force that encourages people and local communities to conserve as well as to enlarge the forest areas based on their traditional knowledge and practices. Community forests also play a vital role as the buffer zone for separating wild animals from humans. Ladies and gentlemen, in this connection, I would like to emphasize that it is vital to tackle the sales and consumption of high-risk wildlife, as wildlife trade chain is the major source of the highest risk of zoonotic diseases. We need to stop the supply chain. Within the supply chain itself, the ASEAN region has been considered as either transit or destination countries. As such, we need to give priority to preventive measures to address the issues throughout the region. The best way to end illegal wildlife trade is to break its supply chain. Thailand, together with other ASEAN member states, have made our utmost efforts to tackle the problems through ASEAN Wildlife Enforcement Network, or known as the ASEAN WEN, initiated in 2005, and has been further developed as ASEAN Working Group on CITES and Wildlife Enforcement since 2016. It has been agreed to allocate necessary financial and human resources and to collaborate in cross-border cooperation and coordination to ensure the effective enforcement of the legislation governing sustainable management of wildlife and their habitat. Moreover, Thailand hosted the special ASEAN ministerial meeting on illegal wildlife trade in 2019 to jointly put forward a policy against illegal trade of wild animals at the regional and the global levels. Such policies have been translated into actions through the Plan of Action for ASEAN Cooperation on CITES and Wildlife Enforcement 2021 to 2025, which highlights law enforcement on the suppression of online illegal trade and the reduction of demand on wild animals. The plan also encompasses ASEAN member states to develop strategies for forestry and wildlife management that take into account the need to prevent the transmission of zoonotic diseases from wildlife to human. The ministers committed to further collaborate with each other to stop wildlife crimes, as well as to raise the people's awareness on dangers of wild animal consumption. As a matter of fact, no single country or region can fight this battle alone. Thailand has thus played an active role in global community, such as under CITES and the Convention on Biodiversity, in order to cooperate with other parties to respond to transnational wildlife crimes. Ladies and gentlemen, although we have put our utmost efforts to tackle the problems at all levels, as I mentioned, transboundary wildlife crime continues to be one of the most pressing challenges we are facing. This challenge has been made more difficult in the wake of the current pandemic. The COVID-19 crisis reconfirms how people and nature are interlinked, and how our negative impact on the natural world increases the risk of future pandemics. I wish that COVID-19 pandemic will be the catalyst for an increased awareness on the need for nature-based solutions. I believe that the best long-term solution to prevent the zoonotic disease is to protect nature. We have to put our nature on a path to recovery for the benefit of all the people and the planet. We have to stop illegal, unregulated, and high-risk wildlife trade and consumption. We need to build a new relationship between human and nature through a sustainable and just economic recovery. We must respect our Mother Nature. For mankind to survive into the next century, we must adapt to nature and not the other way around. This is a pivotal moment to build a safer future for people, our next generation, and our planet. I wish that the outcomes of this webinar will continue to sustainable recovery, which promote environmentally friendly and balanced growth while reducing a risk of emerging infectious diseases. Thank you for your attention. ขอบคุณครับ
So that video message from the Minister of Environment from Thailand was played originally on May 27th during a similar event to this, along with the Minister of Public Health, as well as B.Grimm, Freeland, and the EndPandemics Alliance and WWF. So with Madam Secretary General's permission, we will soon go to our first Q&A session. And just to remind people of two things. First, we will, as you prepare any comments or questions, we will go through the countries alphabetically according to AIPA protocol. You may type in your questions and comments if you prefer, but we will also be giving each country the opportunity to speak on screen as well. Secondly, right after the Q&A session, we will go to our final session, which goes deeper into the tools that are available to ASEAN right now to prevent pandemics. So we will first go to Brunei to see if Brunei has any questions or comments so far on the webinar's subject matter experts today. And of course, there is no obligation to ask a question or make a point, but we do want to follow protocol and give each, excuse me.
Hear me?
Yes.
Yes, okay. So I would like to thank the speakers for sharing their insightful presentations on preventing future pandemic. I concur with the speakers that human and financial resources are crucial in tackling wildlife trafficking. As parliamentarians, we have a duty to ensure that we support policies and legislations that addresses illegal trafficking and improve animal regulation in order to control and monitor the spread of diseases. Wildlife crime is indeed an issue in many countries, and unfortunately, poverty is one of the factors that may lead to poaching. It is not necessarily the poorest who poach, but a major influence is financial factor. The issue of poverty must be addressed in order to resolve the issue of poaching and other forms of wildlife trading. The last presenter highlighted the importance of breaking the supply chain. With the COVID-19 pandemic, causing loss of jobs in many households and communities, how can we ensure that financial stress will not lead to wildlife crime as a means to escape poverty? Thank you.
Thank you, our distinguished colleagues from Brunei. Let's now go to Cambodia.
Thank you. Thank you for giving me this chance to share something about Cambodia. So first of all, may I speak again to honorable AIPA delegates, panelists and moderator from Freeland, Madam Nguyen Tung Wan, Secretary General of AIPA, ladies and gentlemen. Today, I am very delighted to attend this important meeting with the theme preventing pandemic through One Health approach, which organized by AIPA and Freeland. To my views, today, topic is very interesting and crucial, not only for Cambodia or Asian countries, but for the global to focus on living the new normal, combating and preventing COVID-19 outbreak, especially the next pandemics. As we have already known, COVID-19 has shaken our world and the global community because it is a zoonotic disease and spreading from person to person very fast. We have been confirmed the finding from WHO that the root cause of this COVID-19 outbreak is from wildlife. Since I read the roadmap, I would like to say the approach that we are discussing today is a global campaign with convince Asian countries and global community that we must do or we can do for wildlife. Cambodia would continue to strengthen law enforcement for wildlife trafficking and increase awareness raising campaigns. As the result, wildlife conservation and protection have been steadily improving in Cambodia. Cambodia has issued a new regulation with 12 non-native species that are heavily affected by illegal wildlife trade to its list of protected species. This is an important change which will help to provide greater protection to elephants, rhinos, and pangolins. and close a key gap in Cambodia wildlife legal framework. Recently, on March 31st, 2021, Cambodia has just found its 38 Asian elephants that are categorized as globally endangered. So the government has planned, placed, and pushed with both national and international partners to combat traditional wildlife trafficking, protect rainforests, reintroduce tigers, and rehabilitate pangolin that are produced from the illegal wildlife trade. On behalf of Member of Parliament of Cambodia, we would like to express this webinar is considered as one of our Asian agenda to take action in order to prevent the pandemic recurrence, as well as an illegal part of any pandemic recovery and preparedness programs. Finally, I would like to wish today's meeting has fruitful results and wish you all good health and to maintain focusing against COVID-19. Thank you for your kind attention.
Thank you, Cambodia. We now go to Indonesia.
Thank you for the comprehensive insight from panelists. It shows convincing findings and analysis on how the pandemic starts and how to prevent pandemic recurring. Basically, we agree about strong connection between wildlife and our human health. I have several questions to the panelists for giving me deeper insights in these topics. First, we are in line with the EndPandemics report that wild habitat destruction and commercial trade in wild animals are two most fundamental causes of what we call as zoonotic outbreaks. These two triggers are principal, cross-border and cross-sector in nature. How do we strengthen our understanding about the similarity and variation of these trafficking practices across Asian countries? To what extent does the practices can be generalized across the region? Second, wild habitat destruction and commercial trade in wild animals are triggered by increasing consumption. It's basically a luring business and offering much benefits for producers at community level. Regarding this issue, what are the panelists' suggestions to reduce demand for wild animals, especially coming from non-ASEAN countries? How do we change consumers and producers' behavior in our countries? Third, recent findings from Analytical Center of Excellence on Trafficking research also shows that wildlife trafficking has not only destroyed nature and human health, but also exacerbate corruption on these sectors, undermining governance along the supply chains and weakening security for affected communities. There is a need to do some kind of policy reform in several other sectors, such as trades, agriculture, forest management, and so on. One health approach is a good principle to address the issue in a comprehensive way. However, what kind of general strategy that may be effective in pushing reform in other related sectors already mentioned? What are the panelists' views in facing high variety of national and local barriers in doing policy reforms? Fourth, financial investment in prevention is required to prevent the pandemic from recurring. However, at the same time, our national budget are also limited and has been allocated for other basic public spending, such as education, health, infrastructure, and many others. The question is, how do we solve this trade-off? and what kind of strategy you may suggest to find non-public sources of budgeting? Thank you very much.
Some excellent points and questions there from the Indonesia delegation. We will hold off on responding until we've gone through all of them, but we are tabulating these right now. Thank you very much, Indonesia. We will be coming back and addressing those points. Okay, so now let's go to Lao PDR for any points or questions that you may have for our webinar today.
Okay, thank you very much. I just want to share the point with you. As we are a legislative body, we should work to closely together so as to share idea, information, and best practice regarding to development, advancement, and enforcement of law on wildlife, particularly the prevention and control of emerging infection disease on wildlife. In order to end pandemic, we need to focus on for man areas such as reduction of virus to demand, stop virus trafficking, protection of nature, and reform of farming. For now, our National Assembly are willing to learn from another country and stakeholder. That's my comment. Thank you very much for your attention. Thank you.
Thank you very much, Lao PDR, for your comments. Can we now move to Malaysia?
Oh, thank you so much, Honorable Chair, and thank you so much, speakers, for the really insightful sharing and lecture. I concur. I think it is very important that addressing the core issue, including climate change, environmental protection, and of course curbing illegal animal trade is very important. I think the most common mantra in medical is prevention is better than cure, and this has to be the focus, especially with possible future pandemics, especially originating from a zoonotic nature. And I do hope that in Malaysia, I think we are committed in terms of reducing threat, of course, from wildlife trade. I think in Malaysia, we also have wildlife disease surveillance programs in order to monitor the conditions in our country based on the experiences that we had in the past. So I really hope that COVID-19 serves as a huge reminder of the global impact of these zoonotic diseases. I think the roadmap that we need to look forward has to have this global community response. We cannot no more work in silos, and it's not an intra-country issue. In ASEAN together, we play an important role. So I think I would like to leave that with one question. I think we are majoritarily supportive in principle of the steps that have been taken in terms of curbing illegal animal trade, and this has been consistent since the beginning. But my question is, what do you think different will come up, especially with now the COVID-19? How can we ramp up such efforts, such educational awareness, and also habitual change, especially in our region? Thank you.
Very good. Taking note of your comments and your questions here, distinguished delegate from Malaysia. And we will be coming back to these. We will now move to the Philippines for your reflections or questions on the intervention so far in today's webinar.
Thank you. I don't have a question, just a few comments on what has been discussed. I just want to thank our speakers today for sharing an insightful information regarding this pandemic. And as a legislator and health advocate, I realized one important thing today, because of this experience on pandemic, I've been leading the introducing legislations in the country that will address the current problem on the health system, like on the National Health Security Plan, having that Center for Disease Preventions, and many more. The creation of Virology Institute of the Philippines, but I've realized that pushing those legislation is not enough. We need to address also other problems, especially on pandemics, as presented by Dr. Abila, on that concept of One Health, which I think we should take seriously as of the moment, because he said since 2004 it has been discussed and introduced. But I think even in our country, in the Philippines, we're missing that approach on the animal health and ecosystem health to link it with human health. So thank you very much, Dr. Abila, for that presentation, and to our other speakers on preventing the future pandemic and what we should do. I think we need the heads of the state uh, for the enforcement, if we have existing policies and laws on preventing that illegal trade on our wildlife or wildlife crime, I think we need a strong political will from our leaders, because we know that we legislate, but the enforcement or the implementation of the policies that we make, very important is the commitment of the heads of the state. Thank you very much.
Thank you very much, distinguished delegate from Philippines. Your comments are noted here. And finally, we go to the delegation from Vietnam.
Thank you, moderator. One thing that I concern is that what is the livelihood initiative development for the household, for the people who living dependent on wildlife market. Wildlife market here, I mean that the illegal market in the context of national budgets. So can you give some solution to settle this problem? In my opinion, the root of the problem is from the people and for the people. Thank you.
Very good. Thank you, Vietnam. So listen, I think to stay on track with our agenda, all these comments or questions are noted. We're going to address all of them. I'm going to suggest that instead of trying to answer them all right at this moment, that we go to our final speakers and roll these questions into the final Q&A, which our Madam Secretary General very wisely reserved at the end. That way I think we won't run over too long, and also I'm aware that our next speakers can also address some of the points that were made here. But please, everybody who's chomping at the bit to respond, there is going to be ample time to do that. Hang with us. All these comments and questions have been noted. So we will go into our final session now, and we will conclude that final session with a proper Q&A response to the comments and questions that have been made now, plus I'm sure a few more that will be made based on the next few speakers. So, final session is on tools to prevent pandemics. Our first speaker is Ms. Sally Yang from our organization Freeland, also representing the USAID Wildlife Asia program, where she is head of the governance objective of that 5-year project. And she will be speaking to us about legal tools that are available to help with this problem in ASEAN right now. Ms. Yang, the floor is yours.
Thank you, Steve. I'll share screen now. Can you hear me? Just want to be sure. Good afternoon, Madam Secretary General Van, Your Excellency, ladies and gentlemen. I shall attempt to give you an overview of the regional policy and legal framework on combating illegal wildlife trade. We shall touch upon the regional legal instruments and mandates that are already in place to counter wildlife trafficking and what else is needed in view of the lessons from COVID outbreak and from a One Health perspective. I shall also highlight some of the key legal provisions needed to effectively address the problem and to look at the comparison of penalties on key components of the illegal wildlife trade across the region, to show why harmonization is key to prevent hotspots and exploitation of weaker laws in certain member states. For this presentation, the term wildlife trafficking and illegal wildlife trade, or IWT, have been used interchangeably, but for all intents and purposes, they have similar contexts here. So ASEAN as a region has several policies to address wildlife trafficking issues already. ASEAN bodies, including ASEAN Interparliamentary Assembly, ASEAN Ministerial Meeting on Agriculture and Forestry, ASEAN Ministerial Meeting on Transnational Crime, and ASEAN as a whole have all taken steps and made resolutions or declarations to support combating the illegal wildlife trade. On March 2019, a special ASEAN Ministerial Meeting on illegal wildlife trade was convened in Thailand. This meeting resulted in the Chiang Mai Declaration of ASEAN ministers responsible for CITES and wildlife enforcement on illegal wildlife trade. So the Chiang Mai Declaration effectively laid the platform and direction for the development of the ASEAN Regional Plan of Action mentioned by the minister on combating illegal wildlife trade for the next 5 years. This declaration highlighted the following actions: strengthen cooperation in addressing the illegal wildlife trade in ASEAN, strengthen demand reduction efforts across the region, strengthen regional actions to tackle illicit financial flow associated with illegal wildlife trade, to enhance domestic legislation to give deterrent effect to the wildlife offenses, and closing wildlife market where it contributes to IWT. The two main working bodies in ASEAN that deal with illegal wildlife trade are the ASEAN Working Group on CITES and Wildlife Enforcement under the economic pillar, again, that was mentioned by the minister, and the Senior Officials Meeting on Transnational Crime, which has its own working group on wildlife and timber trafficking that sits within the political security pillar in ASEAN. Now, in 2020, the ASEAN Working Group on CITES and Wildlife Enforcement developed their action plan for 2021 to 2025, using the Chiang Mai Declaration as the policy mandate. IWT, or illegal wildlife trade, as transnational organized crime, involves a number of international conventions and treaties as well. And it is crucial that we look not just at wildlife laws, but also other laws that can be used to investigate and prosecute wildlife crime. In the interest of time, I shall only touch on the relevance of CITES and the UN Convention on Transnational Crime, UNTOC for short. These are the two conventions that are under reformation calls from international forums to address species that are at risk of or high risk of transmitting zoonotic diseases to humans, as elaborated by John in his presentation earlier. All 10 ASEAN member states are parties to CITES. CITES is an international agreement between governments and serves to both facilitate legal, sustainable, and traceable trade, and in more recent years to intercept illegal wildlife trade. Wildlife conservation and protection laws in many ASEAN member states were drafted or amended pursuant to the CITES requirements. This may create legislation inconsistency and conflicts, as CITES does not necessarily deal with the full spectrum of law enforcement and criminality of wildlife crime, especially those involving transnational and organized wildlife crime. The inherent conflict of interests between CITES management and law enforcement prevails too. Further, and more relevant to today's webinar, CITES covers only endangered species. They are classified as appendices 1, 2, 3. Now that is a loophole, as zoonotic diseases do not necessarily come from CITES listed species. All 10 ASEAN member states are parties to the UNTOC. States that ratify this instrument commit themselves to take a series of measures against transnational organized crime, including the creation of predicate domestic criminal offenses. Now, this is important because for most part, wildlife trafficking is not a poverty crime, but that of wealth, both from the perspective of the perpetrators and the consumers. Ivory, rhino, and tiger products, for example, are all high-value commodities going into tens of thousands, even millions of dollars. This means that organized syndicates are very often behind and profiting from the illegal wildlife trade. While the poor village poachers end up in jail, the kingpins of such criminal syndicates remain free. By applying laws pertaining to organized crime, money laundering, and corruption, the resources to combat illegal wildlife trade by organized criminals increases, and the legal repercussions becomes more severe for the wildlife criminals. So, pursuant to the development of an updated ASEAN Handbook on Legal Cooperation to Combat Illegal Wildlife Trade, as a key deliverable for 2021 under the 5-year plan of action for the ASEAN Working Group on CITES and Wildlife Enforcement, we had conducted an updated review of the wildlife-related laws and over 20 key provisions relating to combating illegal wildlife trade. The good news is all ASEAN member states have laws to regulate the illegal wildlife trade. Provisions such as hunting, trading, import, export, re-export, transit, and possession are addressed in their wildlife laws. However, the ASEAN member states are not consistent, especially when it comes to penalties in the region. So I would like to highlight a few key provisions that can be improved and that can make a difference in preventing another outbreak. Possession. Possession runs a high risk of transmission of zoonotic diseases, as we have seen in this COVID-19 and other outbreaks. While all 10 ASEAN member states have stipulated possession as an offense in their wildlife laws, it usually attracts a lower penalty than the other offenses in wildlife trafficking. Consumption. Many countries are very reluctant to penalize the consumers. Instead, they focus on the supply chain. This is still true for several ASEAN member states. Protected species lists. Now, this is often an understated issue in dealing with wildlife trafficking. Not all species are protected at the same level nationally and across the region. The discrepancies include varying level of protection for different species lists. Sometimes the protection does not extend to all the species in a group of species, for example, the pangolin. Some are exempted due to TCM, traditional Chinese medicine or Asian medicine use. And more pertinently, species that are at high risk of transmitting zoonotic diseases to humans are not specifically dealt with in the wildlife laws. With the reality of the pandemic, some scientific experts are calling for a special list for those species with high risk of zoonotic diseases to be included. It will also be very useful if there is a regional scientific authority and review mechanism for the species assessment. Captive breeding for wildlife for consumption and other uses have often been criticized as enabling the illegal laundering of wildlife and having extremely poor welfare and high hygiene standards. Following the COVID-19 pandemic, wildlife farming, both legal and illegal, have been thrust into the limelight as possible sources of zoonotic diseases, together with wildlife markets. In the ASEAN region, the penalties for illegal breeding of protected wildlife are highly uneven and are comparatively lower than other wildlife trafficking offenses. Except for Malaysia, Indonesia, and Vietnam, they have good penalties there. Now, using 4 key offenses relating to the illegal wildlife trade, trading, import, export, possession, and transit as a baseline, you can see that the penalties for wildlife trafficking offenses varies greatly amongst the AMS, from 0 to 15 years imprisonment terms, and 0 to US$ 88,000 in fines, with the highest cap at US$ 380,000. The disparity of the penalties within the region means criminals can operate in countries that have lower penalties, thereby creating a safe haven for them. Penalties need to be strengthened and harmonized across the region to be effective. We really need to start treating illegal wildlife trade as a serious transnational organized crime within the region and globally. This is a graph to show again the same results from the fines. So, wildlife trafficking is a highly specialized field in the criminal enforcement region, which requires specialized knowledge and procedures for effective enforcement. While ASEAN was the first globally and has been successful in creating a regional wildlife enforcement network for investigating wildlife crime, 2 other disciplined areas can benefit from such cooperation and specialization: the prosecution and the judiciary. For now, in ASEAN, only the Philippines has appointed special counsels for prosecution of environmental crime and dedicated rules of procedure for environmental cases. There is also a growing momentum within ASEAN for the establishment of environmental courts. A few ASEAN member states already have environmental divisions set within their judicial systems, but more is needed to be done. In particular, on wildlife trafficking cases, including having rules of procedure and sentencing guidelines for environmental and wildlife trafficking cases. Having a specialized prosecutors and judges as the last bastion in the enforcement continuum will be a significant game changer in the region, and it will set an example to the rest of the world. So Dr. Ronello has earlier given a very good background on the origins of the One Health approach and the rationale behind it. In this last section of the presentation, I would just like to provide a snapshot of where we are on ASEAN Regional Policy Framework on IWT and the One Health collaboration and coordination. In October 2016, the ASEAN Coordinating Center for Animal Health and Zoonosis was established to provide a comprehensive, integrated, and concerted regional approach to coordinate national approaches in animal health and zoonosis measures. This includes disease surveillance, diagnosis and control, and quick response. It provides policy and technical advisory support to the ASEAN Sectorial Working Group on Livestock and other relevant ASEAN bodies in the development and implementation of regional strategy for the prevention, control, and eradication of transboundary animal diseases and zoonosis. Because of the COVID-19 pandemic, the ASEAN Coordinating Council has been designated to coordinate and provide oversight to the ASEAN collective responses to the pandemic. The ASEAN Comprehensive Recovery Framework was adopted at the 37th ASEAN Summit in November 2020, which includes a comprehensive implementation plan. Under its resilience strategy, ASEAN Working Group on CITES and Wildlife Enforcement have been tasked to promote awareness on the risk of zoonotic diseases spread through IWT and support the formulation of recommendations and policy briefs to minimize these risks from wildlife trade and high-risk consumption behavior. This includes measures to address wildlife trafficking from the viewpoint of biodiversity conservation sector, to enhance cross-sectorial coordination on enforcing wildlife protection laws, improve wildlife habitats, and engage relevant sectors and actors to highlight the importance of nature-based solutions to prevent further pandemics. Under the updated ASEAN Handbook on Legal Cooperation to Combat IWT, a section on illegal wildlife trade and the One Health approach has been developed to provide a basis for ASEAN to take steps to achieve an effective and coherent One Health approach. Until recently, most multi-sectorial, multidisciplinary One Health coordination efforts within ASEAN do not include comprehensive wildlife and biodiversity management in their agenda, which should detail approaches to safe and sustainable wildlife use and consumption. However, ASEAN member states such as Malaysia, Singapore, Thailand, the Philippines, and Vietnam have initiated One Health efforts, currently putting emphasis on prevention and response to emerging diseases, including COVID-19. ASEAN has the framework, the mandate, the political will, and commitment to combat illegal wildlife trade. I hope I have managed to give you an overview of the regional policy and legal landscape of the region, which will assist you in formulating your policy intervention as legislator on the illegal wildlife trade and One Health approach. Thank you.
Freeland and the USAID Wildlife Asia Project for that presentation on the legal and policy means that are already available to ASEAN to mitigate the risk of zoonotic outbreaks in relation to illegal wildlife trade. We are now, next we'll go to Mr. Bruce Dunn, who comes to us from Tokyo today. Mr. Bruce Dunn is the Chief of the Environment and Director of Safeguards Division of the Asian Development Bank. He'll speaking to us about options for aligning green recovery programs and finance with pandemic mitigation. Mr. Bruce Dunn, the floor is yours.
Thank you very much, Steve. It's really a pleasure to be here, and to all of our distinguished parliamentarians from across the region, and also to Secretary General, Madam Bunn. It's really a great pleasure to join this session and to be here representing the ADB and to provide you with some perspectives from the view of a multilateral financial institution. So I've got a brief presentation for you today. And there's a few things that I'd like to be able to run through with you. What I want to start off with is just to give you a bit of an overview in terms of ADB's work on financing the recovery to COVID-19. To start with, ADB responded fairly quickly to the escalating needs of our clients in relation to COVID-19. And this initially focused on assistance to meet some of the, really emergency issues such as supplies for PPE. This was followed then by an assistance package, $20 billion to support quick dispersing budget to our developing member countries, as well as support for social assistance and health systems. Then in December last year, we launched what's called the Asia Pacific Vaccine Access Facility to help our developing member countries with safe and effective access to vaccines. And overall, as you can see on the slide here, we've so far approved almost $6 billion in financing for countries in Southeast Asia. Now, even as we are supporting this recovery effort, the stimulus effort to countries in the region, I think the real challenge here moving forward is, how do we start to shift looking at the long term? How do we reduce the risks for another pandemic to emerge, and potentially one that could be even more unforgiving than the one that we're in at the moment? Now, the big challenge there, as we've heard today, is making these linkages between health and natural systems, and they're so interconnected, as we've seen in many ways. So, moving forward, making a green, inclusive, and resilient recovery, and one that includes resilience to future pandemics, is really the critical need that we all need to be looking at here. So how do we do this? Well, given what we know about the relationships between the risks of zoonotic diseases with our food and agricultural systems and the degradation of nature, as we've heard, I think, so clearly from Dr. Abila early on, we believe at the ADB that a One Health approach should really be at the heart of our green recovery efforts. And this is an approach that integrates and links human health with animal health and ecosystems to prevent the emergence and spread of disease. And I'm going to explain this a little bit more in the next 2 slides. So we've been working in the Greater Mekong subregion for quite some time. And quite recently, we have been supporting a technical assistance program on the integration of One Health within the development of the long-term strategy for the Greater Mekong subregion, the 2030 framework, as well as the GMS Health Cooperation Strategy. And as part of this, we recently hosted a virtual forum with Ministries of Health, Ministries of Agriculture, and Ministries of Environment within the GMS to discuss One Health systems in the region and to identify opportunities for further collaboration. Now, this highlighted several key points, and I'll go through some of these fairly briefly. First, everyone agreed that One Health approaches really can provide a range of multiple benefits. Now, this includes from looking at agricultural systems, how do we improve livestock hygiene in ways that can also address the health of ecosystems and the health of farmers, efforts to tackle deforestation and to take deforestation out of agribusiness supply chains, such as through better land use planning and also the protection of wildlife. And as we've heard also, I think from John Scanlon, these can be incredibly important for supporting climate resilience and mitigation. Also in cities, One Health can be implemented through improved sanitation, drinking water, and increased green spaces for recreation. And these have got also multiple benefits, such as flood protection and protection of wildlife habitats. But to be effective, we must strengthen existing cross-sectoral planning and implementation frameworks, and this really is critical. We have some of those in place already at the regional levels, but we also need to develop new ones and make sure that they really are effective. So to take this forward, the GMS participations from the 3 ministries that I've mentioned have proposed to develop further collaborative guidance on One Health, and we're looking forward to being able to support that moving forward. Next, I'd like to mention some of our efforts in supporting the combat of illegal wildlife trade. Now, as previous speakers have mentioned, this really is a priority, not just for biodiversity conservation, but also to safeguard our economies. Now, in the Philippines, ADB is supporting technical assistance to strengthen the country's legal framework. We're working with the Department of Environment and Natural Resources to update the approximately 20-year-old wildlife law that governs wildlife crime issues. We're doing this, though, at the same time as developing a long-term capacity building program and also working on demand reduction campaigns. This includes piloting of new tools to detect and fight illegal wildlife crime, such as tracking wildlife crime through ports, and also using modern artificial intelligence tools to look at digital media. And this actually builds off work that we've been doing in supporting environmental crime issues and the judiciary, including the Asian Judges Network and work on green benches that goes back over the last decade. So next, and as I come towards the end of my presentation, there's a couple of recommendations that I'd like to provide moving forward. The first is really to highlight, and I think others have done this very well, is that we need to be putting nature and biodiversity protection at the top of the political agenda. As you'll see on this slide, in 2021, the World Economic Forum's Global Risk Perception Survey, which harnesses the expertise of the World Economic Forum's extensive networks of business, government, civil society, and thought leaders, ranked a range of issues in terms of what they saw as the threat to the global economy right now, as well as in the long term. And clearly, infectious diseases this year came up on top of the risk. I mean, that's fairly obvious. But I think the interesting point there is that in addition, biodiversity loss was ranked as the 4th highest risk, and also one of the highest risks in terms of existential threats to the economy long term. And overall, when you look at that list, you'll see that 5 of the top 10 risks are all related to environment, natural resources, and climate risks. So given these interrelationships, it is really critical that we focus on the existential threats that are facing our economy right now, and clearly loss of nature is one of those. So there are some specific actions that we've been recommending that we believe can be implemented fairly rapidly. The first is on mainstreaming biodiversity considerations into socioeconomic and sector planning processes, as well as in land use planning, so that we can address some of the systemic issues that lead to economic activities such as agriculture or such as infrastructure degrading our natural systems. Second, we're recommending that we create country-specific infectious disease emergency risk maps to guide land use planning and investments. And this is in a similar way that we do already with things like flood risk maps or earthquake risk maps. We need to look spatially in terms of where are some of the greatest risks and how do we address those? What are some of the risks to fragmentation of ecosystems or placing agricultural activities in areas where we might see hotspots for zoonotic disease emergence? Thirdly, we need to strengthen, as we've heard in the previous presentation, the enforcement of laws that regulate wildlife hunting and trade. And then lastly, we need to support some of these measures through financial mechanisms. And of course, as a financial institution, these are some of the things that we're very much interested in. This includes innovation labs and incentives that stimulate nature-positive investments and One Health. Just to give you an example, there are some areas that ADB is working on, such as the ASEAN Catalytic Green Financing Facility. This is dedicated towards ASEAN. And it uses a combination of technical support for project design to ensure that projects supporting nature and natural capital investments can become bankable. And this is supported by blended finance modalities as well as flexible financial terms. So the idea here is to make projects that are supporting nature more bankable, more viable, so we can include more of these in the programs of both the public sector and the private sector. In addition, we at ADB are developing a new natural capital lab, which will support knowledge on natural capital investment, finance, and innovations. And we're hoping to include a financial facility as part of this. And we're certainly very happy to work closely with ASEAN countries on this program. Then second, in terms of recommendations, is really just to highlight, and I think this is pretty clear to all of the parliamentarians represented here, listening to some of the comments that you made in the earlier Q&A sessions, we really do feel that it's important to maintain our regulations, expand those, and ensure that there really is no rollback as we move forward. Of course, we need to push to speed up the recovery, but we need to make sure that that doesn't result in a rollback of regulations or a reduced focus on global imperatives such as addressing climate change. While this might give some short-term impetus to financial resource availability, it will not set us up to long-term sustainability. So we really do need to strengthen our safeguards and mainstream environmental considerations into decision-making as a top priority moving forward. Now, coming to my last slide, I want to highlight a couple of things that we really feel is important, just summarizing a couple of key issues that I've touched on and a few things that we can look at for the future. One, no single country, group, or discipline or sector of society holds enough knowledge or resources to single-handedly prevent the emergence or spread of future diseases and pandemics. We need to work together. We need holistic solutions, and we need different sectors, institutions, and governments coming together collaboratively across boundaries to really solve these issues moving forward. Second, environmental degradation and pandemics recognize no borders, and we need to set policy incentives towards what we might call net zero loss of nature and make a transition to this over the next decade. And that includes setting financial incentives, including, and this is my third point, we really need to address some of the perverse subsidies that drive unsustainable business practices in our economy. There's a lot of work that's out there from the IMF and other studies that really point to the detrimental impact that these subsidies are having on our economies and how they're driving the degradation of nature. So that's clearly an area that we need to focus on. And then lastly, we need to ensure good policy making by bringing the scientific community together with economists and of course with civil society and many other actors. We need good policy based on good science. And so I'll leave you there, and we will look forward to having opportunities to work further with our ASEAN countries in the future. So thank you very much.
Thank you, Mr. Bruce Dunn from the Asian Development Bank for that. I'm sure that will spark a few questions, talking to us about financing and the green recovery. We will now, before going to our final Q&A and discussion session, where we will address some of the comments and questions from before, plus any new ones that you may have, we have one final speaker, a brief intervention from Mr. Walter Link, who is the CEO of the Now Partners, whose members represent the world's most innovative companies and institutions, ranging from Apple, SAP, Tata Communications, Philips, Unilever, and more. Now, under Mr. Walter Link, has created the United for Regeneration, which focuses on advancing regenerative market economies, businesses, and leadership. He was also a co-owner of the B.Grimm Group, and his brother, Harold Link, helped open up the session today. Walter comes to us from Berlin, Germany today. Welcome, Walter.
Yes, thank you very much, Honorable Chair of Brunei and Madam Secretary General, distinguished members of Parliament and esteemed staff of the ASEAN member states, observer countries, Freeland pandemic campaign members and partners. Thank you very much for inviting me. Thank you for the introduction. And I want to address you today from the perspective of multinational and international businesses with whom I had the honor to work for the past 30 years from around the world to find concrete solutions to some of humanity's greatest challenges and also opportunities, because I think we have to continuously look at where's the opportunity that we can further here. And first of all, I want to congratulate you for holding this visionary meeting. Obviously, a lot of very important things have been said today, but I think it's also important to look at the process that you are gathering MPs and policy members, NGOs, academia, business in one room. And I think that's a a crucial part of finding solutions together. Each stakeholder has important contributions to make. And this is, I think, how we find the most effective solutions. I want to, after so many great content contributions, focus my remarks on one strategic question. And that is, how can we help to move these root causes of pandemics into the center of human attention and action? Because that's how they get resolved. If you look at some years ago, climate change was just another crucial topic that did not get much attention. Now climate is, in everybody's mind. Decarbonization to achieve carbon neutrality is now a key topic in the media, in people's daily lives, in parliaments and governments and corporate boardrooms, among clients and investors. In my home country of Germany, the Green Party in the upcoming elections may become the strongest political force. And more importantly, climate policies and related topics are now at the core of all major political parties. So these topics have moved from the fringe into the center of attention. And I think we need to consider together also how to achieve that for these crucial root causes, so that EndPandemics becomes just as important as decarbonizing the world. We heard that, of course, pandemics cost millions of lives and trillions of dollars, and is a tremendously disruptive force. And on the other hand, also showed us that human populations are willing to change if the reason is good enough. And so every day in the media, we are watching tons of coverage about COVID and about vaccination-based prevention. So we are already looking at prevention, but we are still only looking at the symptoms. We're not looking at the root causes. And so how can we bring the root causes from the fringe into the front page news and the key focus of government action, of action by the world's populations? So how can we change this? I think I don't come with an answer today. I come with a question, I think a key strategic question that we need to consider. And I think ASEAN has the opportunity to lead the world. And this meeting can be a crucial step in that direction. You are obviously a very important voice in the world. And you can stand out by addressing this topic. So I wonder with us together, what other steps can we take to come from the fringe into the center of attention? And if I may suggest, this event and its outcomes may need to be shared with parliamentary bodies around the world, with businesses, with other stakeholders. I think you can play a really important role in bringing inspiration, but also very pragmatic roadmaps of action to leaders around the world from diverse institutions, of course, parliaments and governments, but also others, because again, it is this multi-stakeholder approach that will in the end bring the solutions. And business in particular will of course be very interested that ASEAN is playing this role, because multinationals, local companies from around the world are looking always at not so much only the words, but the concrete actions of governments and multilateral institutions such as yours. They assess what are the countries, the regions that are really safe and supportive for business to go to the next generation, to be part of the next journey of business, the future of business. So I'm excited after this meeting today to bring back to companies around the world that ASEAN is really part of being a world leader in this crucial journey to eradicating wildlife traffic, and also very importantly, the industrial agriculture farming of wildlife that then multiplies the risk to an industrial scale. So again, I don't want to repeat the very important contact topics that you already all shared, but I just wanted at the end of this very important day, line out the question, how can we strategically bring this topic into the center of attention? Thank you very much for your time.
Thank you, Mr. Walter Link, coming to us from the NOW partners in Berlin, Germany. Madam Secretary General, with your permission, we can go into the final Q&A session. Is that okay? Okay, I'm getting an affirmative. So thank you, Mr. Link. You asked one central question there that I think was also asked by the delegation from Malaysia, so I think we do need to get to that. Also, you are one of several speakers who seems to have recognized that this body here, the ASEAN Interparliamentary Assembly, and those joining are talking about things that maybe are not being discussed around the world, that we're having a very progressive, important discussion that needs to be shared with other parliamentary bodies and businesses. And I personally can relate to that, and I'll put another hat on here for a moment. I come from the United States, which some of you may not know is the second biggest importer of wildlife in the world, and the United States was very wrapped up in vaccination rollout and is just now starting to talk about some of the root causes. But I can tell you that this discussion that we're having today, business, MPs, NGOs, scientific experts together, this is unique and this is important. I want to start out the Q&A. We've got some good questions here, and the MPs and others can ask additional ones, but we'll get going on the first round. I will put on my other hat for just a moment to address the concern for communities dependent on wildlife or perhaps on wildlife trade, and the concern about perhaps putting additional financial stress on poor communities from perhaps restricting wildlife trade. And I just want to say first, I personally and our organization and the alliance that we run, EndPandemics, have different stakeholders. I'm not an animal expert, for example. I come from more of a human rights background myself, and I know that my colleagues share concerns about the well-being of frontline communities. And we have stakeholders among us who work on agricultural reform to support impoverished communities. We have folks from the finance sector trying to eradicate poverty, etc. And I think the reason that all of us from these different stakeholders, conservation, health, human health, finance, etc., that we're excited about the One Health approach is it simultaneously covers the health of people, animals, and ecosystems. Because if you don't approach it in that holistic way, everybody, whether you're rich or poor, suffers badly at the end of the day. Also, in the roadmap, you will see reference to, I think, what the chairman of B.Grimm talked about before, and perhaps can be addressed by other speakers in a moment, which is the concept of taking a tiny percentage of the money that is being doled out globally right now in pandemic recovery to possibly compensate legal wildlife traders so they can transition into another line of business, or at the very least put some of this money into nature protection as our really long-lasting vaccine. You know, if we're talking about immunizing Earth from another pandemic or the ills of extinction and pandemics, clearly nature protection needs to be a focus. I think that's something we can all agree on. Let's go to the question from, if I may go to John Scanlon. I'm going to jump around here a little bit, but rest assured we're going to answer all the questions we had. The delegation from Indonesia pointed out findings from an asset report that he was referring to, that there's also from this wildlife trafficking threats to human security, links to organized crime, etc. You spoke about this. So in addition to the One Health approach and the ministries of health and environment, etc., being involved, what needs to be done to make sure that the other sectors of government society are involved to ensure that these threats to human security are also dealt with?
Thanks, Steve, and thanks for the good question. I think overall what we're seeing through the discussion today is the importance of different agendas converging. You know, as human beings, we tend to like to put everything in a silo because it's a little bit easier to break it up into small pieces. But what we've learned is that we have to take a different approach and see issues converge, as we see with the One Health. With illicit wildlife trafficking, what we see is it has huge impacts on biodiversity, climate change, future pandemics, and on security. And that's an issue I didn't touch upon in detail today, but we have plenty of evidence around about the security implications of illicit wildlife trafficking. And here we're talking about illicit wildlife trafficking at scale, not small scale local poaching incidents, which can be dealt with locally. Here we're dealing with transnational organized crime that is shifting huge volumes of wildlife, all forms of wildlife, including fish and timber, across international boundaries, where they're impoverishing local communities, corrupting officials along the way, and creating instability. So we have another reason why we really need to scale up our efforts to tackle this illicit trafficking for all the reasons we've discussed: biodiversity, climate change, pandemics, and security. For that reason, we believe we really need to embed this issue where it belongs, and that is into the international criminal law framework. That is the framework created under the UN Convention Against Transnational Organized Crime, and have it addressed there. This is not a trade issue or a trade-related issue. It's a crime and a crime-related issue that is having significant implications for countries in so many different ways.
Thank you, Mr. Scanlon, and thank you for reminding us that there's a big difference between local subsistence hunting and commercial wildlife trade and illicit trafficking. And this group today is focusing more on this industrial commercial wildlife trade as opposed to localized subsistence hunting. Can we now go to, so we've got a question from several of the delegations that talked about the driver of a lot of this, one of which is habitat destruction and also the consumption of wildlife. Let's talk about the consumption of wildlife first. The question really is, realistically, how are we going to be able to reduce consumption of wildlife? Are there any efforts that can be scaled up? Andre Kushlan from EndPandemics, can you remark on this? And I open up the floor to anybody else who might want to address this as well. Thank you.
Thank you, Steve. Here, I just will make a couple of very quick points. First, on the consumption, the demand reduction is clearly a matter for the whole world to tackle with. Steve, you mentioned that the U.S. is the second biggest consumer of wildlife in the world. So it is certainly something that shall be addressed by the what we call demand countries. And that's why our roadmap to end pandemics has this as a number one action pillar, reducing demand. So it is certainly we'll have to deal with lots of communications, both international and within countries, on the how this relates to poverty and you know, subsistence level issues. There's been a very catchy phrase back in the years that I worked in the World Bank that there are the crimes of need and the crimes of greed. And in the wildlife trade agenda, the crimes of greed have already by far surpassed any importance of the crimes of need. So these are very significantly in the domain of transnational organized crime and the likes, where the supply channels are lumped, you know, between different types of commodities, be it wildlife or you know, arms and other, you know, traffic. And that's where John Scanlon and Steve will certainly have a lot more to clarify if need be. Finally, there was a question, a very pointed question from Pak Yohanes Lema of Indonesia, where he asked, I mean, how how to push the policy reform in these related sectors, and how to deal with the situations where there are these additional costs, but all of our budgets are already lined up and committed. First, again, there are 2 points here. One, on the second point first, on the money part, I have, as you already heard, I had worked for more than 20 years at the World Bank, and public investments and budget allocations and implementation of the various government programs are all the same issues that require a lot of focus and perseverance. But here I can compare what's happened now with COVID, that shocked everyone with the enormity of the costs involved if you don't act, with my very own personal experience. In my younger years, I had a car and I never bothered to buy any insurance. I mean, okay, I live in a fairly safe city, theft is rare, whatever. So, and then my car got stolen. It's a major blow to my budget. I have to buy a new car. It's a major new investment, unplanned. I have to continue to pay my bills, pay for my daughter's education and all the rest of it. But rest assured that, when I bought my new car, I definitely bought a theft insurance. So it's a no-brainer. After such an exposure to such an enormous unplanned loss, you need to make sure it's only in the natural instinct, and it must be the same in the political instinct and the governmental instinct. You are now paying for the huge recovery programs and build back better programs and whatnot, all these stimuluses, with billions of dollars going into those unplanned investments. But as you do those, as you buy your new car instead of the stolen car, then make sure that you pay for the insurance against theft or damage and stuff. So I mean, this will give you a peace of mind. Without it, you'll go crazy waiting for your car to be stolen again. So that's in terms of how you push for the reforms and request, additional budgets, which are really just buying your peace of mind. That's that. And then on the global and how to push reforms from different angles. Again, the uniqueness of today's situation is that everyone was involved and painfully, everyone was impacted, and very painfully so. And there is no, of course, there are differences in we all know that those poorer people got more affected, but it only says that even the rich people were affected. And there's you can, if you really apply your mind and your heart, you can much more effectively build political coalitions around this issue, which will embrace people of different income strata, of different sectors, of different beliefs. So that's your, that's the politicians and the lawmakers' opportunity to really build on this common shock to essentially push through reforms that give you a common response that takes so many people to act upon it. So those are my short remarks. Thank you.
Thank you, Mr. Kushlan. And thank you for your comments about the cost of being proactive is much, much less than the cost of being reactive. I want to enumerate a couple points and questions that were made by the MP delegations and then put those out to our speakers. We heard from Brunei about the issue of poverty and how the financial stress could even increase, not just from COVID, but perhaps from restrictions. That's something to be concerned about. We also heard from our colleague from Indonesia that budgets are tight, and if you spend money in one area, it's got to come from some other area to address all of what we're talking about with One Health here. And he also talked about habitat destruction, asking the question, how do we strengthen reform this? It probably is a cross-border issue and not confined just to one country. And we also heard from Malaysia, who had a similar question, I think, that Walter Link had, which is, how do we ramp up the education efforts across the region to wake people up to the need for One Health, the connectivity between these animals' ecosystems and the connection to pandemics. So I'm inviting anybody, Bruce Dunn, Dr. Abila, we haven't heard from you, if anybody would like to answer any of those questions, just let me know.
Okay, Steve, maybe I'll give a...
Yes, Dr. Abila.
A comment regarding the issue of having limited resources, and it's common, particularly in this region, that we have very limited resources, and what we need is really to have targeted investment and really looking at for I would say low-hanging fruit that we could really harvest immediately. And as a start, the presentation from ADB of having this risk mapping or identifying which are the hotspots where we can put our intervention with our limited resources, identified where areas where there is a higher risk of this possible emergence of pandemics that we can invest. We could support some of people who are living in those areas, in those living to encourage them to avoid really destruction of the habitat, and although they are doing it for the part of their sustenance, but maybe we could provide them some alternative livelihood with some investment. So and we cannot do it for the whole of the region. And as I've said, let's identify which are the high risk areas and start working there, and maybe we could have an impact in reducing these pandemics.
Thank you, Dr. Abila. Bruce Dunn from ADB, any comments on the concerns about, the effect that any of this will have on livelihoods and budgets, and or the habitat destruction question? Any or all of the above? What are your thoughts?
Thanks very much, Steve. I'll keep it fairly brief, but I think what we're seeing more and more from the literature and from experience on the ground, and reports recently such as the Dasgupta review coming out of the UK, which is looking at essentially the economics and the financing around what is the benefit, what is the payoff from investing in nature, and it's hugely positive. The opposite is true of not investing, where we see degradation of livelihoods over time, declining returns from agriculture because water is in low availability, soil is being lost, or landscape level problems such as increased erosion and flooding. We also see impacts for communities that may be able to benefit from long-term sustainable tourism, having those opportunities lost. And we see issues where tourism revenues have gone down during the pandemic for many communities, and that's had some negative effect also on communities that are involved in conservation activities. So the economics is there in terms of investing. It has a win-win for livelihoods and the economy overall. Challenge though is some of those benefits accrue in the long term, and we need to look at financial instruments that can support those communities to be able to sustainably invest. We do also see the need for greater domestic resource mobilization. A lot of support to conservation activities, I think globally, particularly in developing countries, has largely been funded through small grants. Important programs, say, for example, by the Global Environment Facility, one of the largest funder of biodiversity activities globally. But we're not going to be able to get there with a trickle of small grants. We need to look at how do we really put domestic resources behind that, and how can we back that also with innovative financing and getting the private sector involved. So setting the incentives for the private sector and with financial mechanisms. We've seen some of this start to pay off in the climate space, and we're using more innovative tools such as bonds, including corporate bonds that helps the private sector to raise capital for sustainability investments. I think we need to start to adapt some of those for the work around nature. And if we can do that, I think in the long term, we definitely have some win-win benefits. So thanks, Steve. I'll pass back to you.
Very good. We're very respectful of everybody's busy schedules and important schedules. So we are, thankfully, we've caught up here quite a bit, but we are a few minutes over. But let's have just a couple more questions here. We're willing to stay on as long as you want to. Malaysia and Mr. Walter Link asked a huge question before, which is, you know, okay, if we understand the importance of One Health to address the links between, you know, zoonotic outbreaks and what's happening to animals and ecosystems, how do we popularize that? How do we reach the masses? Does anybody here have any ideas or comments they'd like to make to that? Anybody, from MPs to our subject matter experts? Yes, we have a hand up. And I'm sorry, I'm looking at, yes, the delegation from Indonesia.
Yeah. Honorable parliamentarians of AIPA Member Parliament, Secretary General of AIPA, Mrs. Nguyen Tuan Phan, and all panelists, moderator Mr. Steve Galster. We would like to thank you for both panelists' description about tools and potential resources to mitigate this pandemic crisis. Legal and financial are important aspects, although our political commitment and collaborative spirits are vital this effort. Our agenda to mitigate wild habitat destruction and its impact is in line with the global agenda on the 15 Sustainable Development Goals titled Life on Land. We have to integrate our regional efforts to SDGs goals in protecting, restoring, and promoting sustainable use of terrestrial ecosystem, as well as preventing biodiversity loss. Phasing out commercial wildlife trade is one of the pandemic action pillars. As part of constraining strategy, we already have a number of ASEAN laws available to stop wildlife trafficking, which are basically aimed at changing people's behavior and mode of wild trade, providing conservation of co-funding, and building tighter inter-organizational collaboration ASEAN. However, two related questions remain difficult to answer. What kind of strategy that we can push to synchronize many different national legal frameworks, especially dissimilar punishment? What are your suggestions to increase the degree of compliance coming from business actors and other community associations? Cross-border enforcement cooperation is critical agenda in our region. In terms of institution, we already have ASEAN Wildlife Enforcement Network, ASEAN-WEN. While law enforcement in each country is still weak, regarding to the present ASEAN-WEN, what are the panelists' view on this institutional effectiveness in combating wildlife crime and destruction? What kind of the best practice that we can refer? Is there any from other regions that have proved its accomplishment and can be adopted to be used? In additional to legal base, we agree that we have also to transform our agriculture to more regenerative and sustainable practices. More direct and community-based natural protection and natural habitat are imperative, but at the same time, financing scheme and urgently needed. What are the panelists' view regarding the challenges faced by local people in harmonizing sustainable needs and productivity demands? How do we align our financing scheme between economic recovery, pandemic mitigation, and long-term green recovery programs, especially at national level. Thank you very much.
Thank you very much, distinguished delegate from Indonesia. So that we don't go over time too much, I'm going to summarize some remarks here. So we have, I hope, the Lao PDR in Vietnam and Brunei see that we've tried to address your questions about poverty and livelihood, but please do at any time raise your hand if you feel that we did not accurately summarize your questions and you want to add more to that. We've just heard from the delegation from Indonesia, and in addition to some other questions, I think what we're hearing a lot about in the comments here is about finance, right? Awareness, how do we wake everybody up to the need for One Health approach, and enforcement. So I'm going to open it up in a second just to point out something though, on the money side, and perhaps Bruce Dunn, you can come back to us. I don't want to put you on the spot, but you did speak before about the ADB being quite active in the pandemic recovery. I think there were billions of dollars discussed there. One thing that we've pointed out in the EndPandemics roadmap that you all have access to is there has been studies done. There was a widely respected paper by international experts done not too long ago, which estimates that it would take about $26 billion globally over 1 year, and doing that for 10 years, to cure the world of the ills of pandemics and extinctions. If you put that into context of the possibly $11 trillion invoice that COVID is delivering to the world and the amount of money that is being doled out for recovery, that $26 billion it's less than 1%. So it goes back to what we've been hearing about the cost of proactive measures, much less than reactive. And as we know, some of the countries in the world are spending much more on that just on their defense budgets every year on the national level. So I think the money is there. But I would like any responses from ADB or others on the finance side. And also, we still haven't tackled the magic question on awareness. And I think, John Scanlon, you're probably best suited to tackle the last question we heard from Indonesia on enforcement. But first, let's go to finance. Would anybody like to speak to this issue? Bruce, I see your hand up.
Yeah, thank you, Steve. It's a really critical question, and I'll talk just briefly about it. I think one of the challenges is not necessarily the absolute availability of finance, but how it is allocated across various different priorities. And one of the critical issues that we are seeing, and this goes beyond the issues that we're talking about today with pandemics, but it's really around domestic resource mobilization and aligning taxes and subsidies, or to put it another way, aligning incentives for socially, environmentally good activities and disincentives for those that we don't want to encourage. At the moment, there is a misalignment, and I think that drives certain things in our economy that have good short-term gains, but are not necessarily setting us up for resilience in the long term. So I think that is something that we need to look at. There are tools available to do that. There are also things that can be applied locally, and we're seeing experience such as eco-compensation schemes, which can be set up to mobilize resources and transfer funds, say, for example, to protecting watersheds or reforestation. So I think there's a range of tools that can be used there, which can put us on that right footing for a more proactive approach. The other thing that I would say for ADB, as you pointed out, we are supporting large financial assistance programs to many of our member countries. We've so far committed about $30 billion for pandemic response programs. But we're being driven by the priorities of the countries. And there are more opportunities, we believe, to take these sort of green, resilient, inclusive recovery measures into those programs. And that's something, we and others are helping to formulate. Something that we've done recently is establish a green recovery database where we're actually starting to track some of the innovations that are happening globally. So where we're seeing that governments are making good policy measures or good examples, say for example, outside of this ASEAN region, we're seeing massive investment in Pakistan around the rehabilitation of degraded ecosystems as part of their pandemic response. So those sorts of measures are things that many can be taken, and we're happy to work with our member countries and clients to help identify some of those and build them into programs. Thanks, Steve. Back to you.
Thank you, Bruce Dunn, for reconfirming that the ADB responds to requests from governments as to where that aid may go to. Are there others who would like to address these final questions before we start to wrap things up? Sally Yang.
Hi, Steve. So I'll just like to quickly address the issue of financing and obviously, financing from partners, NGOs, international organizations, and private sector, or rather collaboration is very important. But there is this measure that actually both Steve and we've talked about this for many years, right? And that is the conservation fund, where the countries become self-sufficient, and at the moment, I think the only country that has a provision within their wildlife laws is the Philippines, and they have a provision under their laws to talk about conservation fund. Around the world, you have a lot of other different examples as well. In the US, you have that too, in Canada, and a lot of other countries too. So the combination of appropriation, fines, damages, and restitution, right, would be able to feed into this conservation fund, which will then help with either law enforcement training, compensation, habitat rehabilitation activities, and using basically what the law enforcement community has been able to gather. Now, this is tied in with also having a very effective prosecution and sentencing structure within the system itself. And that's the reason why in my presentation, I was elevating that as something as a game changer, because if you have specialized prosecutors, we are not targeting at the village poachers. We're targeting at the international, transnational organized criminals that move wildlife products, whether legally, illegally, or whatever. And so they are the target. And of course, the judges need to understand what levels of sentencing they need to give these people as well, of course, supported by effective law themselves and penalties. So that's, I'll leave it there for the conservation fund. Moving just slightly a little bit away, but addressing the Indonesian parliamentarian question on how effective is ASEAN wildlife enforcement network doing. So as I was saying that, they have been very active in the last few years, right? Looking at what they can do. And just very recently in 2020, late 2020, they have actually drafted, and we assisted them with the drafting of their 5-year plan of action on counter wildlife trafficking. Very ambitious goals. And one of the things that they wanted to do was, first thing they wanted to do was to update their handbook, the legal handbook, where all 10 ASEAN countries' laws are updated so that they know where they are. So addressing the question of how do we improve, how do we know, how do we harmonize within the region? This is one of the steps they are looking at. We look at the baseline, we look at where each ASEAN member state is, and then on a regional level, they will then decide whether there are any priorities in terms of, ensuring that it's harmonized. And as I understand, the Secretary General is very keen to make sure that this handbook is not just a coffee table book, but rather something that would have an implementation plan going forward. So there's a lot of motivation from what I'm seeing working with them.
Would anybody else like to speak up before we summarize this and turn it back to our chair? Okay, well, we've certainly had a robust discussion here, and I want to recognize also we heard a similar remark before from the distinguished delegate from the Philippines, who I noted before was not just a legislator, but also previously a practicing nurse. So she brings some extra expertise to this, which dovetails with the questions or the comments from Malaysia and Walter Link before, which is we need to probably also go beyond laws here to, public awareness about making that link. I think two things I'd like to say before we wrap this up. One is I think we need to remember, this is the viewpoint of Freeland and the EndPandemics Alliance, that legal trade can also pose a health threat. In fact, in SARS and possibly in COVID-19, it would have been legal wildlife trade, not illegal wildlife trade, that would have sparked a virus transmission from an animal to a person. So we need to keep that in mind. But also, most importantly, I want to just say that I think today's event has been designed and can certainly lead to some solutions that address the questions and challenges that were brought up by this community today, specifically movement toward a One Health approach, movement toward financing One Health approach, which, by the way, if you look into it more, actually helps save money because it brings policies and mechanisms together out of silos between agencies and civil society and can actually reduce budget. But also, let's face it, everything costs money, like we've heard from several MPs. So going back to what the ADB said, it is a matter of prioritizing. The money's there, but how are we going to spend it? We've also heard about the availability of expertise and tools on enforcement from Ms. Sally Yang just now in the ASEAN Legal Handbook. There's also an ASEAN action plan on counter wildlife trafficking that exists already. And we heard from Mr. John Scanlon about EndWildLife Crime and their work to amend the UN Convention against transnational organized crime, because there still is no convention to combat and prevent wildlife crime. So clearly there are partners and tools already available to help out. We do hope that you take advantage of the presentations, the roadmap that was presented today. We are here as a partner, Freeland and our alliance with the ASEAN Interparliamentary Assembly. So this does not need to be the end. And we certainly will continue to liaise with the experts and partners that we brought in today to make sure that this is not the end of the story. We're here to help. And we appreciate very much, like what Walter Link said before, this progressive thinking by the ASEAN Interparliamentary Assembly, because we're not having this event right now over in Europe or the United States, but we'd certainly like to, and we hope that this video will be widely shared to inspire such progressive thinking. Madam Secretary General, I give the floor back to you in Jakarta for any final remarks.
Thanks, distinguished parliamentarians, ladies and gentlemen. I'm very excited to see that our webinar today is very interesting, very informative. I think that the insight and experiences, as well as policy that's shared through the presentation of our distinguished keynote speakers and parliamentarians serve to better understand the origin of the COVID-19 pandemic, as well as give us a better understanding of One Health approach and also the long-term solution to prevent them. And we all agree that these long-term solutions are always cheaper than to pay for the post-pandemic response and recovery. I am very glad to see that today in the comments from the AIPA member parliament, we heard that a lot of them shares their support to the policy and also legislations. They emphasize the importance of the reform of the regulation in order to stop wildlife trafficking and protect biodiversity in the region. And we know that all ASEAN member states have law on illegal wildlife trade. And we have the ASEAN legal framework that we can support, AIPA member parliament to develop their legal intervention to address these important issues. However, I think that we still have much to do in order in the future to address these important issues. From the AIPA Secretariat, we continue to recognize the important work of the Freeland and international donors communities by providing technical assistance to all member states in their effort to protect biodiversity and eradicate wildlife trade. We remain committed to collaborating with our wonderful partners in advancing our collective efforts to combat wildlife trafficking. Ladies and gentlemen, on this occasion, on behalf of the AIPA Secretariat, I want to sincerely congratulate Mr. Steve Ganster, Executive Director of Freeland Foundation, for leading this important work. I thank all the keynote speakers for your excellent presentation, including including B.Grimm Chairman, Dr. Harold Ling, Mr. John Cullen, former Secretary of CITES, Dr. Abila from World Organizations for Animal Health, Mr. Andre Kashlin, former World Bank and UN Fund Managers, Mr. Brooks Dunn, Chief of the Environment and Director of Safeguard Division, ADB, and Sally Ang, our very dear friends from USAID, and finally, Mr. Wanton Ling, the CEO of the NOW partners for joining this event. And I'm especially grateful for the insights and comments from AIPA member parliaments. And I wish to emphasize once again that the role of MP are truly crucial in law-making process to combat the wildlife crime, as well as in scrutinizing the concrete actions of the government. I really want to thank all of you for joining this webinar. And last but not least, I want to thank the Asia Work Technical Team, our colleague in the AIPA Secretariat, as well as National Secretariat, for your hard work, effective cooperation to make this event possible. So thank you very much. Hope to see you again in many more occasions in the future. Stay safe and healthy. Thank you very much.